meeting. So if you can hear a bit of noise in the background, it is my printer going. I've got a printer session going here, so hopefully that won't you won't be able to hear that too much. So welcome everyone. There's a lot of people here at this meeting, so I'm not going to suggest that we go around introducing ourselves. It could take quite a long time, and we have got a lot to get through today. So what can I suggest that people introduce themselves when they speak, so that everybody knows who everyone is. I have to, unfortunately, read a very long and quite dull announcement about online meetings, so I'll do that first. So I'd like to inform everyone present that this meeting will be recorded in Microsoft Teams and will then be uploaded and available for repeat viewing on the Council's website. Councillors, officers and partners attending will be asked to introduce themselves before they speak at the meeting for the benefit of the public. To help me manage the meeting, if any members of the board wish to speak during the meeting, please can you indicate your wish to speak in the chat section of the screen and then wait to be called. And obviously that will help us, hopefully everyone get their turn that way. When not speaking, if all attendees could put their microphones on mute and switch off their cameras, and when called to speak, please switch on your camera and unmute your microphone and pause for about 3 seconds to follow for the slight time delay in connection. If you are addressing the meeting, it would be best if you can have your camera on so that people can see who is speaking. However, we are aware that we're at the mercy of everyone's broadband services, so it's possible that loss of connection may happen, or if your connection is poor, you may find that it improves if you turn your camera off. So we'll understand if that is necessary. Okay, right, so sorry about that rather long. I'm sure everyone's memorised all of that. Right, let's get going then. First item, declarations of interest. Have we had any declarations of interest, Nikki?
I haven't had any. If people have got anything to say at the meeting, then they're welcome to say so.
And if it occurs to you during the meeting, you've got declaration of interest, and obviously declare at that point if you can't think of it now. Okay, so it's not on the agenda, but I always ask, apologies, Nikki?
Yes, I've had apologies from Shona, Melissa Wise, Eilish McCarthy and Rachel Spencer, although she may be able to come later on. And yeah, and also the people from Teresa Bell, the independent chair of the Safeguarding Adults Board, she's coming about 3:45 to 4:30, so she will be here, but will be later. So we need to have her item 12 in that period, but she will be coming later on.
Yeah, no, thanks. So there's a couple of people that are only available at certain times, so I'll explain that as we kick off. And Nikki, if you can also, if I sort of forget, and we're about to eat into that time, and obviously both of us try to remember that, I'm sure we'll keep that on track. So thank you. Okay, so the next is minutes of the meeting held on the 9th of October. I'm not planning on going through them page by page. Has anybody got any matters arising or points of accuracy from those minutes that they wish to raise? Now's your opportunity. In which case, we'll sign those off. Well, I'm not quite sure how I'll sign those off, but I guess when we meet again, Nikki, I'll be signing about 20 different bits of paper, won't I? But okay,
that's exactly what we've got them all in a folder ready to get people to sign them, and we can see you again. Brilliant.
Okay, questions. I don't believe we have any questions, do we, Nikki? Or petitions?
No, Chair, no questions or petitions.
Okay, great. In which case, as I said, we've got our colleagues from Royal Berkshire Hospital are kindly coming along to give us an update. They're only able to attend between 2 and 3, so I propose that's item number 7 to take that first. And so people are aware as well that, as we just mentioned, Teresa Bell, who's the independent chair of the Safeguarding Adults Board, is only available between 3:45 and 4:30. So item 12 may well jump the agenda in order to meet that. So we do have a very heavy, very long agenda. So we're obviously going to need to get cracking. So we have introduced, so the Royal Berkshire Hospital Trust to come along. I believe we have Nikki Lloyd. Well, actually, perhaps you can all introduce yourselves as you introduce the item. Over to you.
Thank you, Chair. Hello, everyone. My name's Nikki Lloyd. I'm the Acting Chief Executive at the Royal Berkshire Hospital. I'm here with my colleague Andy Statham, who is our Director of Strategy, Transformation and Partnerships, and also my colleague John Underwood, who is helping us from Freshwater Communications with the work we're doing on the site redevelopment programme. Chair, if I may, I'd just like to thank everyone on the call for the support that we've had from colleagues across the council, and you know, huge amount of help. I know we mentioned this on the HOSC meeting earlier in the week, but I didn't want this moment to pass without thanking you for your support. We are, as you know, an anchor institution with the council as part of the community here in Reading and beyond, and the way that colleagues have been able to work together to support getting patients home safely, the use of the Holiday Inn, the Care First home care, it's giving us huge practical support on the ground, and also that many of the work that the colleagues are doing around supporting the community and keeping people well and out of hospital is hugely helpful too. So I will do my usual plea to everyone, if you're not already, I'm sure you are, adhering to hands, face and space so that we can stop this virus spreading, and also to remind everyone that we're still open for business. We are treating urgent conditions, and if you or anyone you know has unexplained bleedings, pain that won't go away, or a sudden lump emerging or anything, please do come forward for health advice, and we're open and ready to start you on treatment if that's what's right, or diagnose and give assurance that there isn't anything wrong, but best to get checked out. So that's my plea to our community over, and I make no apologies for reminding everyone of that. But we're here today, thank you very much, Chair, for your invitation to talk about the exciting project that we've been working on for a number of months now, again with many colleagues who are on the call have been involved, helping us to shape our proposals to move towards an estates redevelopment. I'm going to ask my colleague John Underwood to join and to share a short slide deck, and then after that we'll have the opportunity to take questions from colleagues about the content. So without further ado, John, please would you take us through our short presentation?
Thank you very much indeed, Nikki, and thank you, Chairman, once again for the invitation. As Nikki was saying a few moments ago, my name's John Underwood. I'm the Communications and Engagement Advisor on what is frankly a very, very exciting project. And I'm going to share my screen now, and hopefully that should be a shared screen. Can I just double check? Can everybody see that?
Yes.
Okay, very good. In which case I will proceed through the slides. So I think, first of all, by a quick word of background, as it were, the Royal Berkshire Trust is able to proceed with this exciting project to redevelop its buildings and its facilities because just over a year ago, the government announced the latest phase of its health infrastructure project, the so-called the HIP plan, which provides funding for new hospital projects over the next 10 years. The Royal Berkshire Trust was one of 21 trusts to receive seed funding to develop ideas for new and refurbished hospital facilities. And as Nikki was saying, over the past few months, we have been developing the first stage of that process, which is the development of a strategic outline case for our regulators and for the Treasury, which identifies a number of options or scenarios for future development. And I'm going to share in a few moments with you where we've got to so far in that process. One thing I should say is that all redevelopment possibilities have been considered and are continuing to be considered. Absolutely no decisions have been taken on what is the best way forward. At the moment, we're just in the process of developing the optional scenarios. The one thing which is very clear about this project is that it's a major opportunity both for the NHS and for our local communities, both to improve services, to improve patient experience, to improve the local environment by developing zero carbon facilities, and to support the local economy too. The case for change in respect of our buildings and our facilities is a pretty serious and pretty unanswerable case, and it's based on these 5 C's, as it were. The existing hospital buildings are in some respects in relatively poor, certainly suboptimal condition, and this can result in less than perfect patient experience, certainly poor working conditions for our staff. It can lead to high maintenance costs, and it can lead to safety risks too. So there are issues relating to the condition of our buildings. But then there's also the question of capacity. The hospital is currently operating beyond its appropriate capacity, and it's operating beyond what the local population growth is expected to be. And that only means that there will be greater health needs and rising demand for services in the future, and we need to do something in order to meet those needs. It's also true to say that the existing buildings were designed and were built to support a 19th and 20th century model of healthcare. And of course, healthcare is moving on at breakneck speed in terms of the way in which it's developing. And the buildings currently limit our capability to provide really, truly high quality, modern 21st century care for our local communities. And the existing buildings, because they are so old in many respects, are also a poor environment, both for patients and for staff. And rather than helping to solve the climate emergency, they actually contribute to it. And with newer facilities, we certainly can make a much bigger contribution to a green environment with, as it were, a low carbon hospital. And finally, there's the question of the degree to which we can be, the NHS in Reading can be a catalyst for change and for further developments. The idea of developing a really modern healthcare campus for Berkshire would generate jobs, undoubtedly, and economic growth. And I think the idea of new and refurbished facilities would act as a catalyst for the local economy for many years to come. So having said that, let me move you on, if I may, to the possible scenarios that we've developed so far and which are outlined in the strategic outline case that we have now submitted to our regulators and to the government. There are 6 scenarios in total, the first 2 of which may seem extremely unambitious. They are that we could do absolutely nothing at all. And if we did nothing, then we would be addressing only the most high risk backlog maintenance issues, as it were. Or we could do the absolute minimum. And that would mean addressing perhaps a little more of the backlog maintenance issues that we face, but still not really taking us forward in any meaningful kind of way. It's worth making clear that these 2 scenarios are only included because as we develop a strategic outline case, we are required to include them as a benchmark against which the other much more exciting, much more interesting options are really to be measured. But as an issue and I suppose a measure of completeness, I mentioned both of those scenarios here, so consider them to be scenarios 1 and 2, not really what we want to be doing, but against which we're measuring all the other options. If I then move on to these 2 options, the top one is option number 3, and the bottom one is option number 4. And option 3, and you can see a diagram here, which is a diagram of the present site. It's very diagrammatic, so it's not a formalized plan, but you can see in the middle of this slide, the red block is a new emergency care block. So scenario 3 would involve the development in the building of a new emergency care block at the present hospital. That would also include an expanded A&E unit. It would include new intensive care unit facilities as well, and new operating theatres. And the value, in a sense, of scenario 3 is that it helps us separate emergency care from planned care. And that is a real important holy grail, in a sense, in all aspects of modern healthcare delivery. The problem with scenario 3 is that it has limited ambition and it doesn't fully meet all of our requirements for future demand, but it is the first step in the right direction, as it were. Scenario 4, which is the one at the bottom, it builds on scenario 3 in a sense. It involves a new emergency care block, plus a new elective care block, and in addition, new women's and children's facilities. And this enables us to really grow the scale and scope of the clinical services that we provide at the hospital, and much better helps us to address developing local needs. It also carries with it the potential possibility of building a medical school here in Reading. And as I say, it really is that this is the more substantial step in the right direction. If I then go on to options 5 and 6, option 5 here is the top one. This involves essentially building what is a substantially new hospital on the current site. Many of the buildings would be demolished and would be rebuilt. A small number would be refurbished because they're still in a condition in which that would be possible and appropriate. This would fully meet our growing demand, the growing demand needs of the local community. It would involve a greater integration of health and care services. It would certainly involve a medical school, and it could involve research facilities as well. So that is, if you think of that very largely as being a new hospital on the present site, you pretty much have the measure of option number 5. And then option or scenario number 6 is a completely new hospital built on a greenfield site away from not where the current hospital is located. I should be clear, that site has not yet been selected. There's no question of anything being sort of predetermined in this respect. But this is something which could address all local needs. And of course, what would be really good about it is that it would provide the blank canvas on which completely, totally new modern facilities could be built. And it will give us the opportunity to create a zero carbon health facility. So it's worth just explaining very quickly that as we are considering all of these options, these possibilities, they all have different pros and cons. And these are the kinds of questions that we've been considering as we've been developing these scenarios. First of all, there's the question of adjacencies. That's ensuring that the services within a hospital that really need to be close to each other really are appropriately and properly co-located. So if, for example, you need the X-ray facilities very near to A&E, let's just make sure that's exactly where they are. Then there's the question of the environment, developing an environment which is green and low carbon. Some of these options help us to move in that direction more than others. And of course, there's the question of the economy. We want, as Nikki was saying earlier on, we are, along with the local authority, we are an anchor institution here in Reading. And we want to really develop a hospital which supports the local economy, supports local communities, and helps to create local jobs. And then finally, we need to consider things like compliance as well. What sort of scenario actually helps us to ensure the greatest compliance with modern safety guidelines and modern guidelines that dictate best practice? And of course, as we're considering those, inevitably, we also have to consider cost. It's all very well to say this scenario gives us the best outcome in terms of the environment, but if it also happens to be the most expensive scenario, then that's clearly something that needs to be borne in mind. And finally, there's the question of convenience, considering which scenario can most easily and can most conveniently can be delivered. And in some ways, of course, building a new hospital on a greenfield site means that there will be no disruption to the hospital on its current site. But then on the other hand, that might well be the most expensive scenario. So all of those things are things which we really are considering as we, or were considering as we tried to pull together our strategic outline case, and they will continue to be major considerations as we move forward. And it's worth flagging up a couple of absolutely crucial features of our case. First of all, where we're located, here in the Thames Valley, home to really one of the world's largest life sciences clusters, companies and organisations that are really critical in the fight against coronavirus, future pandemics, and a whole range of other issues that are really at the forefront of healthcare in the 21st century. And again, it's just emphasising this fact that we're an anchor institution. We're not going anywhere. We're here for the duration, as it were. And we want to deliver great health services, but we also want to see if we can do that, plus support the economy and support the local community in a wider context. So I'm coming towards the end of this presentation now, just 2 more slides. Where do we go from here? Well, this is really a courtesy update for the Health and Wellbeing Board. In December, just before Christmas, we submitted the strategic outline case to our regulators, who are now considering it. We propose to continue the engagement with all of our stakeholders, local authorities, patients, staff, all sorts of other stakeholders as well. And the next step really is that what we're proposing to do is to move on to the next stage, which is to develop an outline business case, which really puts more flesh on the bones of these various options and scenarios. And then finally, to develop a full business case, which will be the document which helps us to seek to persuade the government to give us the money that we need in this community. And the final slide is just simply a little reminder for everybody that on our website, we have, this is the Royal Berkshire NHS Trust website, which is royalberkshire.nhs.uk. You'll find a little button which says Building Berkshire Together. And that is the story and all of the information about this particular project. We branded it, in a sense, as the Building Berkshire Together project. And that's where you will find out much, much more about the project itself. Chairman, Nikki, that concludes the presentation. So I will endeavour to close my screen and hand back to Nikki and to you, Chair, to take any questions that people may have.
Thank you, John. So as you can see from the presentation, we've done a huge amount of work already. There's a huge amount of work still to go on, and we'd be delighted to take any questions from colleagues, myself and Andy, if that would be appropriate at this point, Chair.
Great. Thank you very much, and thank you very much for the presentation. And yeah, absolutely, it would be appropriate. That's exactly the time for questions. So I'd like to obviously, you did come very kindly along to the Council's Adult Children's Education Committee, which includes health scrutiny and outlinings as well. So I don't intend to repeat some of the things I said then, other than to welcome the involvement and engagement you're offering to the Council, but also to this board. And I think that's great and really important, because this will be one of the biggest sort of infrastructure projects for Reading in the coming years. And to emphasise both that desire to be involved, and I think also possibly the thing that came out of that discussion was that as a council, as you'd expect, representing Reading, we're very keen, particularly on the more ambitious projects in terms of delivering, the large scale investment and the new facilities that we really require. And anybody that visits the hospital, and you've said yourselves, know that this investment is sorely needed, particularly in some parts of the hospital. So welcome that very much. One of the things that you did at the previous at the meeting on Wednesday was to outline some of the timescales that you sort of envisaged. And I realise that's very difficult, because a lot of those next steps aren't necessarily in your gift, but that was quite useful in terms of your views, in terms of the timetable you think you may be moving to. So I don't know if you just wanted to let the meeting know that, and then I've got some people who wish to have some questions.
Certainly, I'll ask Andy to talk through the details on the timing, please.
Yeah, I think as we said to the Adult Social Care Committee, this is a moving feast on timescales, and largely being driven by the financial environment nationally. And the impact of the spending review period. So we are a health infrastructure programme 2 organisation, and that means the majority of our it's expected the majority of our funding comes in the forthcoming in a future spending review. It's probably timed around 2025 is where they're expecting the majority of the funding for us to be released. That's all up for conversation at the moment, and Department of Health is reviewing, where schemes are up to. So we feel like we're in a really strong place by having got a outline proposal as we've just discussed about where we could go. We are thinking that that over the next 12 or 18 months, we need to make this decision about which of the options we're able to progress, having taken into account, the affordability challenges of those, the impact that they'll make for patients and for our community, and the views of all of our local stakeholders as to the benefit of those various options. So I hope that kind of provides some idea in what's quite a moving picture at the moment.
No, thank you. That's really exciting and really helpful and actually quite exciting in terms of the timescales you're talking about. Right, I've got Councillor Tony Jones has indicated. Tony.
Yes, thanks, Chair. And I did have the benefit of listening to the presentation earlier this week. So, I'd like to start with some thanks to Nikki and her colleagues. First of all, Nikki, thanks for acknowledging the partnership work between the council, the hospital and the health authorities with the Holiday Inn project, which of course was pioneered in Reading, but we've seen more recently is now being advocated more widely across the country. And I just hope that people have learnt some of the lessons that we were able to develop with you. Certainly, we're very proud of that partnership working with the Royal Berks that we've been able to engineer. And secondly, and I did mention this earlier, but I'm so chuffed to be so pain-free. Thank you for my new hip. The Royal Berks were able to give me a new hip on the 19th of December, and now I'm stick-free and pain-free and everything else. So that's brilliant. I can add some further thanks. I think the Royal Berks does an incredible job on that site, considering I think, as you've already acknowledged, you've kind of outgrown the site and outgrown some of the facilities. So to deliver what you're able to deliver, both in terms of crisis and as a matter of routine, is personally something I'd like to thank you for. And in my role as lead member for adult social care, thank you for that too. Having studied the various options, I just wanted to ask a few questions around option 5, which is the kind of the greater redevelopment on current site, because I think the first four options to me have little appeal in terms of either kind of do nothing or do as little as we can. And option 6, in terms of moving to a new site, I think that's a whole kind of different discussion. So certainly as one of the local ward councillors, which includes the Royal Berks within our boundaries, I just wanted to concentrate on a couple of things. One would be in terms of that full redevelopment of the site. And let me say that as far as it's possible, I would absolutely support the future proofing of the site, if that was your preferred option, as far as technology and finances allow, and nobody can escape the financial constraints of all our wishes and dreams. So in terms of that, two issues: the massing of buildings, if you like, what a complete redevelopment might look like, and secondly, and I've seen you do this elsewhere, Nikki, so you might just want to check the time, traffic congestion and parking. So those two issues. So firstly, in terms of option 5 and essentially the stage-by-stage redevelopment of the site, I mean, it does seem to me that the existing footprint is already very well developed and is perhaps even a little cramped. And I did hear in an earlier presentation that, of course, one option when you have a finite amount of space is to build upwards. So in terms of accommodating some of the ambitions, say, for a medical school, which again, I would certainly absolutely hope that the Royal Berks could be successful in, perhaps university hospital status or whatever those things mean. How far do you think that the current massing of buildings may need to change to accommodate all the ambitions included in option 5? You know, there are already some buildings which are quite massive and there are others which are low story. So, you know, what might local residents see in those? And then secondly, and very differently, as much as certainly in Reading, we value and treasure the Royal Berks and we see it as Reading's hospital, ignoring the fact that you have to serve a population of 500,000 or 600,000 people on a much wider area. You know, and I quoted some figures to you earlier this week, you know, traffic is a problem, whether it be people working in the hospital or patients visiting or visitors visiting patients in hospital, to the extent that outside of the town centre and the Oxford Road and Wokingham Road, the number of parking tickets that Reading Council collects in the streets immediately around the hospital amounts to twice that as the rest of Reading combined. And I think that's an indicator, if you like, of some of the pressures. I know that the multi-storey car park is often full. I know various initiatives have been taken both for staff and for other things. So going forward, you know, we are where we are today and those pressures exist. But going forward 10, 20, 30, 40 years, and we know all kinds of transport things may change, how would you imagine the Royal Berks in its planning could mitigate or improve or accommodate some of the further traffic pressures that hopefully a completely new build hospital would generate? Thank you.
Gosh, there's quite a lot to unpack there, Councillor. If I can just take the first one about massing first. So colleagues or residents who have been to our site will know we've got a whole range of buildings at the moment, from single-storey Nissan huts on West Drive on Redlands Road to 5-6-storey buildings such as the maternity block on our site, which is a sloping site. The number of the designs that we've looked at consider different massing, and you'll have seen from the presentation that John just showed about how we might use space. I think the important thing to look at is we're trying to create the built environment for our clinical services, and one of the things we're looking at already and will continue to look at is what actually needs to be on site. So what could be elsewhere? You may be aware we've got so we operate from 7 sites across the area, and we've already started exploring what activity might move off onto those other sites. So certainly outpatients and dialysis and imaging is widely available across other of our sites. And also colleagues will be aware that through the pandemic, we've adapted many of our services to offer, as well as face-to-face appointments, we also offer significant quantities of non-face-to-face appointments, and we remotely monitor patients. So the healthcare built environment that we need, and therefore the massing of the buildings that we need, it's all around our clinical services strategy, and that's going to determine what size buildings we need, how much space we need to create, and how those adjacencies and the massing will be required. We talked a little about the traffic and the congestion issues. One of the design things in HIP 2 is all around zero carbon and making sure that we have a sustainable way of operating our hospital buildings, whether that's from a financial point of view or from an environmental point of view. So we're already, as you know, working with yourselves with Reading Buses to make sure we've got viable public transport offerings for our many staff to come on site from all over the area. We're already looking at, we've already started improving and continue to do so, our showers and our facilities so that colleagues can cycle or run or walk to work. And we're also working with our suppliers to make sure we reduce the logistics impact of our activities, looking at how packaging is used and the delivery routes and the frequency of deliveries, because all of that obviously has an impact on the local roads. And the issue you raised about the wider population, certainly for some of our services where we offer more than DGH services, we have specialist services for things like cardiac and bariatric services that we run from this site. So we do cover a broader than just a district general hospital patch from a commissioning point of view. I think the thing that's is important, I'm conscious of time, is the need for us all to stay very communicated and involved in helping design this together. So as you'll be aware, we've had a microsite and thousands of people have been involved in helping us shape the plans we've got to this stage. As we move from strategic outline case to outline business case and start drawing up the very detailed floor plans and exact requirements, we're really keen to continue to work closely with colleagues like Health Watch and other organisations to make sure that we get all of those ideas in as to how we can continue to be environmentally sustainable going forward. And we absolutely want to make sure as an anchor institution that we're enhancing the environments we occupy, not causing them to be detrimental. Andy, do you want to add anything, particularly around the massing of the buildings, maybe?
Well, I was going to put a bit of numbers to some of the this. So I think it's important that you know, the modelling that we've done suggests that we need less than 10% increase in beds to meet the clinical model, and most of that is to deal with the ageing of the population. And we're also assuming a reduction of between 25 and 33% of the outpatient work through making good use of our sites across Berkshire and through digital channels. So I think, if anything, the clinical model we're proposing should help drive down the footfall anyway, along with some of the measures that we're taking, as Nikki was saying, around travel and transport. But I recognise that's from a position, as Councillor Jones noted, that is, you know, one of the biggest challenges facing Reading population in terms of transport. So.
Great, thank you for that.
Yes, thanks for those answers.
I'm back on my screen. Would you like to?
Yeah, no, thank you. Very helpful answers.
Okay, I've got. So I just remind people to. This is pointed at you, David. To introduce yourselves as when you do speak, so that people know who everyone is. So I've got David Monday.
Great. Thank you, Chair, and thank you for the presentation. I'm the public health consultant for Reading, and really good to kind of get an update on what the plans are. Thinking more broadly, you talked about a hospital fit for the 21st century, and I wanted to understand the degree to which within the kind of infrastructure development that is being planned, that you're giving consideration to the concept of a healthy hospital and how that can be kind of built into the fabric of what's happening at the Royal Berks. And I know it sounds like an odd thing to say. Can you think, how could a hospital not be kind of healthy? But having worked for 15 years as a nurse clinically before moving into public health, I know that, whether it's things like food and beverage availability and what's healthy or not, whether it's about kind of smoking policy, whether it's about how much active travel is encouraged or is available for staff commuting to and from the hospital, whether it's about the thousands and thousands of contacts with patients, and the preventative messaging and screening for alcohol tobacco. There's lots and lots of things hospitals can do to kind of promote health and to prevent ill health, not simply treating the acute phase of illness, which is clearly the bread and butter of what the hospital's there for. But just wanted to understand the degree to which that is or could be in scope for what your plans are, because certainly, as you might expect from a public health perspective, we'd be really keen to kind of work with you and to kind of do those kind of partnership bits to ensure that was there for staff, for patients, but therefore for everyone in the borough and beyond. So welcome comments on that.
Yeah. So David, this is absolutely a really big agenda item for us. Starting with the well-being and health of our staff, and it's one of the reasons why we're making some of the investment in now into our travel options for staff to encourage that active lifestyle. We've been thinking quite a lot about how in all designs we create green space for patients and for staff, so that we're creating the opportunity for people to be to get some outside and break time in there. And then the kind of the food and nutrition item is something that has been a feature of our quality account over the last few years. It's something we are working on with our suppliers and vendors in the hospital as well, to help shift with that nudge emphasis towards healthier eating. I think there's we're absolutely we're a no smoking facility and policy for staff, but obviously that compliance with that is one of the biggest issues that we have. But I think that it's a really important agenda, and I think there's always more we can do on this. So I'd welcome a further conversation with yourself about ideas and things that we can do to strengthen that, both now but also as we move into the new hospital.
David, you may have seen that we were chosen by the Prime Minister and the Secretary of State at the end of October to launch the NHS food review, because we're one of the few hospitals in the country that prepares and cooks all of the food on the premises here, and we're seen as an exemplar for food being part of the offer to keep staff well, but also as part of the recovery of patients so that they can get home well nourished and not experience what can happen after a hospital visit, which is malnutrition. So you may know as well, we're opening our Health and Wellbeing Centre for staff later this year. We're renovating 17 Craven Road to make a garden and a health and wellbeing facility for staff, again to help provide that encouragement to stay fit and well. So we're doing a lot in the meantime, but it absolutely will underpin our designs and planning for the future. But really keen to keep working with you, and let's stay close.
Great, thank you. Really helpful response. Thank you.
Great, thank you. I've got Mandeep Baines.
Hi, I'm Mandeep from Healthwatch Reading. Thank you, Nikki. You actually started to answer my question, so hopefully John can follow it through. As the plans develop and become more detailed and concrete, what sort of engagement and consultation activity do you have planned to ensure that stakeholders in the local community continue to be part of that development?
Okay, I will ask John to answer that. He's my comms expert. He'll answer it much better than I will.
Hello, Mandy. Good to see you again. Obviously, one of the things that I think is important to underline is that the approach will definitely be a co-productional type of approach, as it were. So, I mean, that is best practice, and that is certainly the approach that we would want to be taking. I think one of the issues that I think is worth flagging up at the present time is that, of course, the global pandemic does obviously have an impact on our ability to meet with people face to face. We are extremely keen to to meet face to face when it's safe and proper and appropriate so to do. So, you know, a lot of the kind of co-productional type of work that I know you've been involved in the past really does involve numbers of people together in a room for, you know, typically half a day or even longer, you know. So clearly there's a limit on what can be done at this particular time in that context. But certainly that would be our intention. Having said all of that, you know, I think it's also fair to say that over the course of the past year, the NHS has made tremendous progress in terms of being able to use digital technology in order to undertake things which perhaps originally we may not even have thought that we could do with technology. So one of the things we've done in this particular context is we've had some focus groups, some focus discussion groups with people from seldom heard communities and so on. And actually what we've done is we've made inputs to help them ensure that they can use the technology before we then actually try and have the online discussion. But some of those have worked, frankly, have worked better than I'd anticipated they would, which is very positive. But I mean, the broad answer to your question is, what kind of engagement do we anticipate going forward? The answer is deep, substantial, continuous, and you know, and involving. And I think that's really the best one can say about this, and that would be true for all of our communities within the catchment area that the trust serves. Does that help, Mandy?
Thanks, John. It is reassuring to know that this will be a continuous process as plans develop, and really, will there also be a formal consultation is just my other part of that.
Well, I can offer this thought. You know, I think it would look as if we're heading in that direction, but you know, I think it does ultimately. It does depend on what the option is that we end up going for, because clearly, if there is very little in the way of geographical change, then there may not be. But Andy or Nikki, would you care to add a thought in that respect?
I was going to say something similar. I mean, the position that we've recommended to NHS England and then on to Treasury and Department of Health is that we focus in on the last three options, 4, 5, and 6. And that they, you know, back us to progress those. If they go down that way, obviously there's a clear choice that we have to make about staying or going, which definitely falls into the you know, the realms of consultation and engagement with the public about the impact of that choice, which is absolutely something we do. If you know, so it's a that's our intent. If the decision comes back that the programme can't support that kind of amount of money, it kind of leaves you with options that are just on this site. So I think that we're into the realms of active engagement, but we don't necessarily have that level of substantive change of provision and location that would warrant going into the formal. But you know, the level of engagement that we want to and involvement that we want to have wouldn't be deterred by that discussion. It's just which channel we're down.
Thank you.
Great, thank you. Got Ramona Bridgman with a question. Ramona.
Yes, thank you, Chair. So I'm Ramona Bridgman. I chair the Reading Families Forum. So we represent families of disabled children 0 to 25. And we have had some say in the consultation, but I haven't heard it raised today. And it is important information to families is about the accessibility of the hospital. I mean, Nikki, you talked about the west side. It's really hard to push a child or a teenager in a wheelchair from one of those huts into the main building and all along there. It's really hard to take a child to A&E, paediatric A&E, if you've got a wheelchair, power packs and all those kind of things that disabled children often need. It's very difficult to do lifting of children. You are dependent on the hospital finding a mobile hoist that is charged up. So a lot of families really struggle to lift their children onto examining tables and etc. I mean, it's not an accessible hospital, and it needs to be in the 21st century. And I understand the pressures of parking, and I know when you've increased the site before and you've used disabled parking spaces, it becomes even more difficult. I mean, I will often, with my disabled teenager, arrive at a hospital an hour early, not to get a parking space, but to get a safe double yellow line to park on. And I think a lot of disabled families ending up in that situation. And I think I just want to highlight that with everybody, that it is causing a lot of stress to a lot of disabled families. Thank you.
Ramona, thank you for raising this important issue, and I guess we became aware that we weren't doing all we could in this regard, and certainly this isn't something we're going to wait for site redevelopment to address. We've commissioned an expert company called Accessable to review all of our site access. So that's looking at things like ramps, things for visually impaired, looking at the auditory environment for those who have hearing difficulties, and generally the wayfinding, and how straightforward is it to get from one place to another and to find your way. So the wayfinding, but also physically. So what can we do to the built environment to address those issues that you've raised? During late February, March, we're going to be demolishing most of the West Drive buildings. So you have my assurance that patients won't be asked to go in those Nissan huts again. We're demolishing them. Again, we were lucky to get drawdown funds from HIP2 to do some enabling works in that regard. But no, all of the areas that we operate from are being covered by this extensive Accessable review. And we will be digesting the recommendations from those experts to look at what we need to do to address the issues that I'm sure we can do improvements to. So that is something we've immediately addressing, and I will be able to, hopefully next time I'm here, share some more information about that with you. But that's certainly informing the works that we're going to be planning for that. We have got specialist equipment, as you know, which can be used, and again, it's making sure that that's sited in the places that it's required and not the other end of the site, because that's no help at all if you're arriving on a rainy day. So yeah, those considerations are all going to be picked up through that, and they will certainly inform the design of the new built environment, wherever that is, recognising increasingly the need to be a very welcoming organisation for whatever needs our visitors, our staff, and our patients have. And we know over time some of the things that are some of the design features that are on this site, you would never get planning for some of the things we have at the moment, and that's a great opportunity for us to build that into the future designs. And that's why, if I can please ask for your continued engagement to help us, because we want to make sure that we've picked these things up as we evolve our plans. So the microsite we've talked about, can we have town hall meetings, the regular meetings, but your input and insights will be hugely valuable to us to shape the designs for the future.
Thank you, and it's good that you've got that in mind. Thank you very much.
Thank you.
Great, thank you. And I was just about to say nobody else is indicating, but Deborah Glassbrook, I think, has raised her hand. So Deborah.
Yes, good afternoon. Hello, Nikki and team. I'm Deborah Glassbrook. I'm the Executive Director for Children's Services here in Reading Borough Council and Brighter Futures for Children. And I know we've not had the pleasure of meeting yet, but it's very nice to meet you this afternoon, and indeed to hear the great aspirations for the local medical provision and hospital provision. So thank you for that. My question is really about opportunities that there might be for apprenticeships, both through the sort of tenders that you're writing and thinking about the sort of the build and all the opportunities there might be there for our young people. And then, of course, once it's open in terms of what the hospital might be able to provide in learning opportunities, apprenticeships and work experience. And we'd be delighted to hear anything you've got to say about that, please. Thank you very much.
Yes, and yes. We absolutely recognise the the wide range of skills and talents that's on our doorstep. Certainly, we have close links with the college, and we're really keen reaching into local schools as well. And yeah, there will be a lot of work in that regard. Building on the apprentice programs, one of the things we're keen to do, we're meeting with the national team shortly actually, and one of the things I know that's being picked up through the national team is to make sure that across the programme we're building in the best practice, so that amongst suppliers to the schemes nationally, the requirement for apprentices and the commitment to provide skills and development, and obviously it's a huge economic boost for any locale to have this scale of development from a jobs creation point of view. So absolutely, that's going to be within the DNA of the project, and everything we can do ahead of the project as well. So with existing suppliers and opportunities to create those opportunities for people.
Thank you. That's very reassuring. Thank you very much.
Great, thank you. So I don't see anyone else indicating. So thank you so much for coming along, and certainly music, well, I think to our ears, that your commitment around the ongoing involvement, both of people like yourself, the people like here, your partners, the council, but also much more importantly, the communities of Reading and the wider communities that you serve, and that's really important. So thank you very much, and we will, I'm sure we'll be seeing a lot of each other over the years as this progresses. So unless you have anything to add.
Just a final thank you from you and colleagues on this call for your support thus far, and our citizens for your support in helping to stop the spread of the virus at the moment. That's our very immediate thank you. And I say a reminder, we are open for business, so please don't stay away if you've got a health concern. We're open, and just really looking forward to working with you and keeping you involved as we journey through the next stage of this exciting development. So thank you very much indeed for the opportunity to join you this afternoon, Chair.
Great, thank you very much, and very much on that point of reducing the spread of the COVID virus. Our next item is an update or the impact on the COVID-19 in Reading. There's a range of people going to be involved, but David, are you going to lead on and take us through?
I'll kick us off and then kind of hand the baton on, if that's okay, right. Chair. So Nikki's helpfully sharing the slides, so I'll talk through them as we go. So the purpose of this item is to update on the impacts of COVID-19 on Reading at the moment, and it falls to me to kind of go through the epidemiology, I guess, as the public health consultant, and I'll touch on then the impact for adult social care services as well, but then others will pick up other impacts on services, service users and residents that we're seeing at this time. So Nikki, if you could move on to the next slide, please. While that's happening, I guess it's worth noting our last board meeting was in early October, and it's worth saying that things have moved on somewhat since early October, in terms of we moved in and out of and then back into a national lockdown in that time, and even in the time that I have between putting these slides together and today, some of the numbers has changed, as you might expect. So this slide just is showing us what's happening currently across Berkshire, but obviously I'll highlight on Reading in terms of the proportion of people that are going for testing, or our testing rate, should I say, but most importantly, in the kind of brighter red, our positivity rate, so the proportion of people testing positive for COVID when they go for a test, and then what our overall case rates are. So since this data was put together, our positivity rate in Reading increased a bit further, but I'm pleased to say is kind of dipped back down again now to stabilising at around the 17% mark, and the case rate, so the rate of people for every 100,000 living in Reading that test positive in a week, in this data was just over 550. It did go up to 800 as we saw that continued increase locally. That has now started to come back down again, and is at 682 on the most recent data. An indication, therefore, that we are beginning to see a dip again now, having had that spike in Reading, but it is very early days to say that we're truly coming down that other side. And I think the message is, and as you've already heard from NHS colleagues, you know, that the hands, face, space, the social distancing, everything we all know we should be doing very much has to continue. So apologies, these data aren't the most current, but as it updates each day, it's not always possible to get the latest onto the slides. The final thing I'd say about this is also it shows us our case rate in the over 60s, and again, so the number on the slide there, the 375, is increased a bit a few days after publication of these slides, but again has started to come down again, and that's very important because we know that's what drives more than anything the pressure on the NHS that we're all aware is kind of acutely an important factor at the moment. So next slide, please. So we can segment data in a few different ways, and this slide is segmenting the data by age, just to understand a bit more than an overall figure for Reading, what's happening in a little bit more detail. And clearly what you can see here, and the lighter the shade, the yellow or the whiter, the lower the rates, and the darker, the blacker the shade, the greater the rates. And this gives you a rate for every day over the last month based on the 5 age groups that you can see on the slide there. And clearly what jumps out is that in under 15s, our rates are reasonably low compared to kind of what I describe as working age adults. It's quite a broad category, I know. And then again, our rates in the over 65 seem kind of lower again, quite comparable actually to that within the 0 to 15 age group. And although the numbers have moved on a little bit, again, since these slides were put together, that trend remains exactly the case in Reading. To help understand a bit what's happening in our age groups. We can also segment data by ethnicity, and we talked through that at our last Health and Wellbeing Board and our last Local Outbreak Engagement Board in some detail. When we also segment by geographical area, and I've not included a map in today's data, we see a bit of variation, but often the numbers are so small when you break into ward or smaller areas across the town, it's hard to make meaningful comparisons between different parts of town. But this is just there to give you a feel for kind of what's happening in a little bit more detail. So next slide, please. So to pick up just the comparator piece, so Reading's not alone in the increase that we've seen. Although the scale's quite small on these 6 graphs, so apologies about that. Really what this is showing us is that this again is our case rate per 100,000, but shown over time. And you can see that whilst there was gradual increase and then a little dip over the autumn, since December, a significant increase has occurred in case rates, and Reading's numbers are in the blue line on that slide and the graph that's titled Reading, and then the comparison to the southeast and to England is in the orange and in the grey. So you can see that the Reading experience has been mirrored very much with what's happened regionally and nationally, and then you can compare to the other local authority areas across Berkshire, and undoubtedly Slough's had the highest rates, and it looks West Berkshire the lowest, but within the kind of central patch of Berkshire, you know, the Reading experience has been very much borne out by the neighbouring areas. If we move on to the next slide, please, Nikki. So we've heard quite a lot talked about in terms of the variant of concern, as it is kind of technically referred to, which undoubtedly has been responsible for the increase in case numbers that we've seen both locally and nationally. So I'm not going to read out everything on this slide here, but let me just make a couple of quick points. So we know that this variant is more transmissible. We also know that it is not, when people become infected with it, more potent or more dangerous, but simply that it is infecting more people. We know that the same social distancing rules, the hands, face, space rules, the usage of personal protective equipment, those preventative, COVID secure, those mitigations, whatever you want to call it, remain relevant, remain applicable, remain effective against this variant. But the time now is to do those things all the more, because we know it transmits more easily from person to person. And importantly, we know that the tests that we have available are accurate in detecting this strain of the virus. And we also know that the vaccinations that we have available that we're rolling out will remain effective against this variant. And it's typical of viruses to change and mutate quite frequently. So I think we should expect, and we've all heard in the news about some other variants that may be circulating. I think we will expect there to be mutations and changes to the coronavirus as we kind of move through the pandemic. If we move on to the next slide, Nikki, just to demonstrate then what's happened in Reading in terms of death from COVID. So this is showing us the data since the pandemic began in March of last year. And the blue bars are showing you where death is directly related to COVID, and orange is showing where a death is from another cause. And if you can pick it out, the grey kind of wiggly line is showing you the average death rate for that time of year over the last few years in Reading. And all I would really draw people's attention to is to say, you can see in the last couple of weeks that data is reported for here, we have started to see an increase in COVID-related deaths. So I think it was 10 cases the week ending 1st of January. And we're above that grey line, i.e. above where we would expect to be. And it is important that we measure the impact in terms of mortality on the overall numbers of deaths, because some deaths can occur in a pandemic that aren't directly related to the infection, but due to some of the wider kind of issues that occur in a pandemic situation. So in Reading, we're at about 26 or 27% higher than we would expect to be when you think of the data from the 1st of March last year to where we are today. So I appreciate a sobering thought, but an important one to be monitoring. Next slide, please, Nikki. So apologies, these have come in the wrong order. This is back to something about the variant, and apologies, it's not the best formatted data. What this is showing you is since the 1st of September down to the last week of December, of the two columns with numbers in, the left hand of the two is showing us the proportion of cases of COVID where they are down to the, if you like, the standard type of the virus that's been circulating. And then on the right hand side showing you the new variant of concern and the proportion of cases that are down to that strain of the virus. And the SGTF is just the S gene target failure, which is how labs look for this. It's kind of a proxy measure for this variant. And you can clearly see that shift in the proportion from the wild type, or what was the standard circulating type, back in early September through to the vast majority of cases by Christmas being of this variant. And I think the numbers, this is Southeast data, the numbers are now available kind of at a local authority level, and in Reading it's about 80% of cases are estimated to be down to this new variant. Next slide, please, Nikki. So testing clearly remains an important arm of what we're doing to combat the impacts of the virus here in Reading. So our testing rate is good, our turnaround times here are good. As of today, Prospect Park has been converted from having a mobile testing unit a few times a month to being what we call an LTS, a local testing site. So it's open 7 days a week, 8 till 8, and people attend kind of on foot to a pre-booked appointment to get their test. We are rolling out lateral flow testing in Reading, so that is already very available for university students that are returning to the borough. For those who are having face-to-face teaching, it's already available for our care home staff in the borough. It's already available for our domiciliary care staff. We've started, it's available now within schools, and we put our effort and energy into piloting first with one of our secondary schools in Reading to then roll that learning out to others. And people may have followed a national announcement a few days ago that lateral flow testing for staff in primary school is also now being rolled out. So there's lots of deployment of these tests, which just to remind, don't require lab processing, but give you a result within about 30 minutes or so. We're looking to expand the programme further than in Reading and developing a key worker testing program. So NHS and care home staff are already covered, but thinking about other people who work in Reading who aren't able to work from home and need regular testing to ensure that they haven't inadvertently picked up the virus. So that's something that we're working on and rolling out, and that will start in February in like a phased approach across the various sectors of employees in the town who, as I say, can't work from home and are essential workers and need that regular testing. And then as lockdown measures release and as we move hopefully down the local alert levels and people are able to be out and about more, that offer will become a wider community offer. So more of that to follow in due course. And of course, it's important to understand that with the convenience of the test, in terms of it not needing a lab to process it, we do compromise a little bit on the accuracy of the test. And therefore, we are careful about where we deploy testing. And really, this testing is beneficial to check that people have not inadvertently picked up COVID and have what we call asymptomatic infection. And it's really useful in doing that and finding additional cases of COVID that otherwise we wouldn't have known about, and you can ensure those people and their contacts isolate. What we can't do with the test is deploy it to be used for people and then say, well, now we know you're not infectious, you don't need to worry about the COVID secure measures that should be in place. So if people test negative, we can't say to them, oh, you can now mix more socially than others, or you no longer need a face covering when you're shopping or on public transport. So we have to be cautious with what a negative result means, but we're very swift and active when we see a positive result on a lateral flow test and the subsequent isolation, etc. So if I just move on, I think the last couple of slides from me then are just on vaccination. So just to kind of note very quickly, I think as people will be aware, we have 3 vaccines that are licensed in the UK. They are all safe, they're all effective, and we know that they will have a significant impact on reducing mortality from COVID-19. There's 2 doses to the vaccine, and I think people will have seen the coverage kind of in national press whereby we're opting to get as many people vaccinated with dose 1, which gives you really good immunity really quite quickly, and then at around the 12-week mark, giving people dose 2, which is designed to enhance that immunity and then give longer ongoing protection. And we await the insight nationally in terms of whether people will need to be vaccinated again in a year's time or at a certain time intervals kind of going forward. So that information will come out. And in summary, we're vaccinating people via hospital hubs if they're health and social care staff, via primary care networks for those in the community who are eligible, and I'll show you the groups in a moment. And then there will in time be the development of a mass vaccination site as well. We're really keen to hear from the community, hear from residents where people have questions and concerns about the vaccine. We will use those bits of information that we hear to adjust the messaging, the support, the promotion, the engagement that we're doing as a council and with partners to try and support uptake of the vaccine. I don't think we very much want to have a conversation with people, with community groups, with residents to understand where concerns and anxiety lie, because undoubtedly there is some vaccine hesitancy, as it gets called, kind of out there, and I think that's understandable. We know these vaccines are safe and effective, but don't want to kind of stand in the corner or stand on a platform and just shout about that, but want to engage with people and understand what those questions and concerns are and how we can best address them. So we're running an event with some of our minority ethnic group community leaders, some of our faith group leaders on Tuesday evening next week to have some of those conversations to try and understand that better. There's really good resources that are available. I know there's been questions about a resource leaflet which is for older, encouraging uptake within the older adult population who we're vaccinating currently, and we've made that available to people online. We've got information about that programme in the leader of the council's email to residents this week, and we're trying to make information available in a range of languages as well, to kind of make things as accessible as possible. So I think the final slide from me, Nikki, if you don't mind flipping on, just goes through the priority groups that we have for vaccination, and this is laid out nationally. And this is a risk stratification approach whereby we're vaccinating essentially in order of the mortality risk from COVID, which is, I think, absolutely the right approach to be taking, and NHS colleagues may well be commenting later on just on how we're doing in terms of moving through that. So I think that's everything from me on the kind of epidemiology, and then on the testing and the vaccination. Nikki, if you could move forward a slide. So what I'll do is just speak to the next two, which is then talking about how we're supporting service users and residents within the adult social care world, and then pass on to colleagues to talk about other elements of services for local people. So I think it's probably fair to say that in summary, all services that we should be providing in terms of adult social care services are kind of running and are available to residents, and a bit like how you heard from the NHS earlier in regards to the hospital being open for business. That's very much the message in adult social care. Some services run as they always have done. Some are working in new and kind of COVID secure ways, but very much we're very much going to open for business. I think it's worth saying that the need that we are finding as people present to adult social care is greater at this stage than it has been pre-pandemic, and I think anyone who runs frontline services would be able to relate to that experience. We're running face-to-face visits where we're able to, but we do virtual assessments and support where that's necessary. And it isn't simply a case of face-to-face whenever you can, unless and then if you can't, doing it remotely, because in some instances, for example, with our hard of hearing services, it's actually preferable to do something over video, and therefore face masks aren't needed, than pursuing a face-to-face approach, but where face masks make communication more difficult. We're clearly ensuring that PPE remains available. I'm pleased to say we're in a strong position in terms of availability of that, particularly when you think back to where we were early in the pandemic. And then we continue to offer respite services for people that are in need of those. So some of our elderly support and also our learning disability respite care continues. It's already been alluded to by Councillor Jones, our care hotel model, so the Holiday Inn service, and this is an expansion of our discharge to assess model, where we have step down facility for people whose destination on discharge from hospital would be home, but there's a delay in getting them there for whatever reason. And that's a 20-bedded facility. It's been running now for a week or two, and already has saved 110 hospital bed days from the Royal Berks by virtue of being able to get people out of hospital at the earliest opportunity. And then next slide, and this is, you'll be pleased to hear the last bit from me, in terms of how we're supporting the provider market, then there's quite a lot that's happening. Clearly, we've been supporting access to vaccination for the adult social care workforce as a fundamental plank to how we're combating COVID-19 here. The mutual, the business continuity planning support, revolves a bit around them providing some mutual aid where that's needed, and supporting with risk assessment and being able to consider kind of what visits are essential and what things can be combined where there are challenges. And undoubtedly there are staffing challenges in our provider market because of people needing to isolate because of having contracted COVID-19. Clearly, we're having to do quite a lot of work to help providers who can feel a bit inundated with national guidance, with national rules, with national changes to the kind of latest advice on X, Y, or Z, and it can feel quite a confused time for busy frontline services. So we're doing a lot to ensure that we're summarising and supporting people to be able to follow the latest guidance. Our quality monitoring is really well supported by the availability of a care home support team that works across Berkshire West, so that's from the local clinical commissioning group, to ensure that infection prevention and control practices work well. And then in terms of our kind of revised service offer and what we're offering, so there continues to be day service support. Some of that is done virtually where it can't be done in the usual in-person way, and in other cases day service support is a more in-reach offer for people where the virtual offer wouldn't be appropriate. So that's the canter through the kind of adult social care world in terms of kind of current service provision and how COVID's impacting. I'll pass on to colleagues now to go through other service areas, and then of course, Chair, happy to take questions on anything I've said from board members.
Okay, thank you, David. Right, okay.
Yes, so good afternoon again, everybody. I'm Deborah Glassbrook. I'm the Executive Director of Children's Services here in Brighter Futures for Children and Reading Borough Council, and I'm going to share with you some of the impact we've seen on our services across children's social work, across education, and across our early help and prevention services. So starting with the schools, as I'm sure most of you will have heard in the press, there's been a significant number of children and staff being affected by what's going on in COVID, not only just locally, but regionally and nationally. And we've had a significant number of children and staff being tested positive, and of course another group that have had to self-isolate in bubbles or in year groups since we went, well, basically since we went back to school in September last year. We've also had a significant number of both teachers and children being tested positive, and we get those notifications continuing on a daily basis. So very clear that for a number of our children, their education has been interrupted, whether it's because they've had to self-isolate, whether it's because they've actually had COVID, or actually just because they're not able to carry on going into their schools. So although we've been able to provide some really good online learning for our children, the experience of education for them is interrupted by a number of things at this moment in time. And of course, we're all really quite worried about the long-term impact of COVID and the changing circumstances in which children are trying to have to manage being homeschooled, learning online and going in and out of school as things are at the moment. Next slide, please, Nikki. Thank you. So we have a wonderful team here supporting schools. We've continued since March last year to provide head teachers with written briefings that include all sorts of updated information, including the plethora of DFE guidance, that's the Department for Education guidance, that we are receiving on a daily basis and sometimes twice a day. Myself with the Director of Education, Kate Reynolds, we meet with the head teachers on a weekly basis. That's on a Teams meeting to again give them some updates, provide any support, listen to what's going well and any difficulties they have so that we can find solutions to continue to support them. I mean, they have been absolutely extraordinary, keeping going since March last year, keeping our schools open. Very few holidays or time out, given that they've just needed to go to try and manage, one bit of the crisis to the next. So that's been a really helpful opportunity to meet with them on a regular basis, where Kate and I are able to thank them and appreciate all their hard work. Kate and I also meet with the Department for Education and the Regional Schools Commissioner probably about 3 times a week, sometimes more, sometimes slightly less. But that's again where from those head teacher meetings we're able to raise concerns and to provide some lobbying opportunities so that the decision makers within the Department for Education and the school commissioning can really think about the impact that some of those policies and expectations are having on our schools. And we're delighted to be able to think that we have a good relationship with those people that we meet with on a regular basis, and that indeed the things that we're raising with them are having an impact in influencing some of the decision making. Kate also meets on a weekly basis with the unions to keep them updated and to work in partnership with them, and to again make sure that they are getting the right support to the schools. And then we've also continued to expand our education welfare service so that they can complement the work that the schools are doing and supporting those families that are having greater issues in terms of getting their children either into school where that's appropriate, or to actually make sure that children have access to online learning. And one of the things that you'll know is that we have distributed 656 laptops to our children at schools and through our social workers who are working with more vulnerable families to enable our more vulnerable children in Reading to access online learning. Thank you, Nikki. May I have the next slide, please? Thank you. Thank you. In terms of early years, we know that the majority of settings have been open and have continued to try and open, but certainly in January, what we saw was a 25% reduction in attendance when we first went back to school. The expectation is that all of our early years providers, where it's safe for them to do so, have stayed open, and that has been the guidance. That hasn't always been possible, and certainly some of our maintained nurseries have had to make decisions around what's very best for their children in their nurseries, and some of them, for them, it's not safe for them to open. So we do have a few of our nurseries closed at this moment in time. The impact, of course, on the early years sectors is that they have been challenged financially, and there's been a great lack of clarity around the spring term funding, and that's something that we're continuing to work with the Regional Schools Commission about and budget holders to try and clarify what we're going to be able to do. And certainly there are some great challenges for us at this moment in time to make sure that all of those early years providers are able to get the financial amounts of money they need so that they'll be able to continue to provide the sufficiency we need for our young children. And so our children are school ready and have really positive opportunities for their early learning. And there's some concerns, of course, just following on from David about testing and vaccinations for schools and for the early years providers. And whilst totally appreciating the reason that we're doing it in the layers that we're doing it, you can imagine that for many of our teachers, there have been some real concerns about the testing and vaccinations. And this is one area where we think that some of the lobbying and stuff and the work we've been able to do with colleagues at the DFE and within the public health has really borne fruit in terms of the testing and the approach to vaccinations for schools. So we're very grateful for those. The next slide, please, Nikki. So in terms of social care, so these are our social workers and what's been happening for them. We have got an increased number of children open to us again at this moment in time. We've got about an extra 140, 150 children extra in our social work services at the moment. That's due to the complexity of the work that we've got, but also some of the delays that we've now had in terms of intervention from different agencies and partners that we work with, because we're now offering virtual intervention. And as you can imagine, it's much more difficult to work with families on Teams or virtually in this way, where you're really trying to make a difference in terms of changes of behaviour, understanding issues, and working more creatively. And that, of course, has meant that we've got more children working or being open to us for longer periods of time. There has certainly been an increase in poverty, in mental health, that's caused families acute distress during this period of time. And we're seeing that again as we're now in the Tier 5 lockdown. We can see an increase to risk of children, and especially, as you can imagine, for those children who are confined in their homes where domestic abuse is a key element in that. And we know that that is made worse for families where there is a great deal of expectation of use, or sorry, not expectation, but a huge dependence on alcohol, where there's mental health problems as well as drug misuse. We've also seen an impact on the cost of delays in proceedings. So just to explain this, that when we have children coming into care, what we've actually seen is some delays in proceedings due to the fact that the judiciary has not been able to provide the same level of services, or in fact that families have found it more difficult to go to court in, as you can imagine, again in a virtual way. We've also seen that we've not been able to move our care leavers, so those children who have been in care for a long period of time, who become 18, who may have living arrangements in a variety of different places. We've not been able to move those care leavers or some of our other children in care because they don't want to move to a different setting when they're in a lockdown situation. Not great if you've been living in Wales, as one of our young people had been, wanting to come back to Reading to live in semi-independence, and actually thinking that they'd have to adjust to that sort of living arrangement whilst they're in lockdown situations. And so, as you can imagine, with those two elements as well, there is an impact on the cost for us in actually holding those situations in a longer amount of time than we would expect to do so. Thank you, Nikki. So in terms of social care, what have we been doing to keep our children additionally safe at this very tricky time? We've undertaken risk assessments on all of our children in social care. We also undertook 2,000 risk assessments for all of our children who were at schools and who had special education needs and disabilities. And we review those risk assessments on a very regular basis to make sure that we are taking into account all these different circumstances. And what that's enabled us to do is to think about how many face-to-face visits to our children we've been able to manage. As again, you can imagine in a total lockdown like this, it's really difficult to make or for families to accept social workers visiting them or social care practitioners visiting them. And what we've been able to do is do risk assessments to make sure that those children who absolutely need it are still being visited. And we've also been providing a lot of virtual visits. And interesting, a lot of our families and our children and young people have really enjoyed the virtual visits. What I'd like to do is to say a huge thank you and recognition of the strong partnership working we've had across with everybody working here with us. That's health, that's police, that's the voluntary sector. And everybody else that's in our community that has made a real difference to enabling that strong partnership working. And then finally, what we've been doing in terms of our response is reviewing all the care planning for all of our children that we're working with, again, just to make sure that everything we're delivering gives them the very, very best opportunity during these difficult times. Thank you, Nikki. In terms of early help and prevention, similarly to social work services, we've done risk assessments on all of the children that we're working with. We're doing some face-to-face visits to all children where it's safe to do so. And we have had some concerns, as you can imagine, for those children who are not in school and wanting to make sure that those children are kept as safe as possible. Our early help and prevention services are consensual services, and so of course there's an additional concern where families understandably don't want to actually be involved in the services at this time. So we're sustaining that impact and the work we're doing virtually at the moment and keeping that under review. But again, similarly as I just said about social work services, from an early help perspective, we're seeing an impact on families' mental health, on actually not having enough money and resources, and we're also seeing that in the amount of domestic abuse that we're seeing. You'll know that we have been providing food and vouchers for our families, and that has been a really important piece of work that we did over the summer to provide vouchers. It's a piece of fabulous work we did in partnership with the University of Reading in October to make sure all of our children had food over that period of time, and we've also just done something very similarly over the Christmas period, making sure our children and families not only had food but also got access to fuel. So we've got a very good, strong One Reading Children Young People's Partnership, which is wonderfully chaired by Councillor Terry, who is the lead member for children, and that is moving from strength to strength, and looking forward to doing a lot more impactful work over this next year as well. The other thing that we have developed is a child in need project within early help and prevention, where those children who don't meet the threshold for the higher tier of child in need social work receive the work through the early help and prevention. This is a project that's been funded by the Department for Education, and we're very excited to be able to say that we're going to be reviewing this and evaluating it, and we believe that we've got some learning there that will be impactful across the country, and that's one of the reasons that the DFE have been so keen to promote that. And furthermore, and probably even more importantly, we've had some really good feedback from our children families about how helpful that they've found it to have family workers rather than have social workers when they're at that level of need. Thank you. I'm going to hand over to my next colleague now. Thank you very much.
Thank you. Good afternoon, everyone. My name's Maureen McCartney. I'm the CCG Director Lead for the Reading locality and also the Berkshire West Lead for Urgent and Emergency Care. So I've got 3 slides to talk to. The first one is about COVID vaccination in Reading. David has obviously already talked about that, so I'm just going to briefly mention the vaccination programme that's been undertaken by the GPs in the 6 primary care networks in Reading. So there are 5 sites that have been set up. The first PCN site started on the 16th of December. All 5 sites are up and running now, covering all of the GP practices in Reading. The current focus is, as David said earlier, on the 80+ age group, elderly care home residents and staff, housebound patients and frontline staff. And then the next cohort will be age 75+, 70+, plus the clinically extremely vulnerable patients. General practice has received supplies of both of the vaccines and are making great progress on that. I know Dr. Andy Ciecierski is on the call. He is the PCN Clinical Director for the Caversham locality, and I don't know if Andy wanted to say anything about the vaccination programme from a GP perspective. Maybe not.
Yes, thank you, Maureen.
Thank you, Andy.
I will jump in very briefly. I'm in my surgery, in my scrubs. I've been vaccinating this morning. So to everybody, I'm Andy Ciecierski. I'm a GP at the Emma Green surgery. And as Maureen says, I cover the Caversham site, we've got two practices, Balmoral Park and Emma Green Surgery, working together from the one vaccination site here at Emma Green. We're now on day 9 of 10 of continuous daily vaccinations. We've had a very intense supply of vaccinations, and we started last Thursday, and we think that our current supply finishes tomorrow on Saturday, and we will have vaccinated, I think, close to over 4,000 patients in 10 days. We've started doing, we've used the AstraZeneca for going into our elderly care home. Next week, we'll be doing housebound patients, having a little break from vaccinating intensively here at the surgery with the Pfizer vaccine. We've had a very complimentary, loads of compliments from our patients. I think they're all very grateful to be getting it. It's been quite a challenge with our very elderly, starting from our 80 pluses, and obviously we've got some that go right up to 100 getting it. It took a little bit of time getting them through our processes. Now we're getting the younger ones. We're down to actually our 70 pluses and our clinically vulnerable at the moment, which we'll be doing today and tomorrow. They're a little bit more mobile, so the system's getting slicker. We've got better over time. We're hopefully not having many queues outside our surgery. So I think the general patient experience has been very good. And I think that's reflected across all the sites. I've talked to my colleagues who've been working these vaccination sites across all the PCNs. After possibly a few early teething problems, people might remember from before Christmas, I think things have got much slicker. We're all learning. There's lots of goodwill. I mean, clinical staff are putting in extra shifts to make it possible for us to do these vaccinations. We've got patients acting as volunteer marshals outside, supporting their fellow patients to make sure they can get in and get vaccinated. So everybody's working intensively hard in this very short period of time to make this happen. Thank you very much.
Thank you, Andy. I just want to add two things before we go to the next slide, and that is that we're on target to vaccinate in all care homes by the end of next week, and also that at Wokingham Hospital and RBH Hospital, they're obviously vaccinating health and care staff. And I heard this morning that RBH, they have circa 5,500 staff, and 4,400 of those staff have been vaccinated. So that's great. So thank you, Nikki. If you don't mind moving to the next slide, which is about phlebotomy. So as you can imagine, phlebotomy was significantly impacted by COVID early last year, which meant that access was restricted to urgent only patients. So in August time, that was raised by GPs as a cause of some concern. So there was quite a lot of work done to tackle that and to increase capacity across Berkshire West. So as a result of that, in October 2020, RBH opened back up again to routine referrals, and they launched an online booking system for both RBH and West Berkshire Community Hospital to increase activity for routine patients, and that way they were also able to control the patient flow. And by December, RBFT booking system had created sufficient capacity to increase activity by an additional 10% compared to pre-COVID levels, so that was great. Berkshire Healthcare Foundation Trust provide the service at West Berkshire Community Hospital, and they increased their staffing element so that their service is now open to routine referrals, and they hope to be back to pre-COVID levels by March. So GPs have been kept well informed throughout the whole process, and we think the system have worked well together to identify the issues and address them, the issues relating to phlebotomy. Thank you, Nikki. So if we move to the next slide, I won't read all of these bullet points. I'll go through them more quickly. So it's about NHS 111 First, which I'm sure most people have heard of. So that was a national initiative that was introduced in December 20, and it was really to encourage the public to call 111 first. The 111 service that we have has got a clinical assessment service. So that's manned by clinicians, nurses, GPs, mental health professionals, and they can provide advice to patients. They can also direct them elsewhere, and they've now also got the capacity to book them into ambulatory care pathways at the hospital. Currently, all patients have to go to ED for swabbing, but in the medium term, our 111 clinicians will be able to have direct referral routes into other clinics such as surgical assessment unit, DVT clinics, all of those pathways, which is great. If a patient requires an ED attendance, they can now be booked in, which then they will have a particular time slot that they will be able to attend. And the expectation is that that should nationally reduce what they call unheralded ED activity by about 20%. The numbers at the start being direct booked into ED and RBH were quite low. At the 4th of January, we had 71 patients who'd been directly booked, approximately 10 a day, but that will be increasing every day. That's all I really want to say on that slide. Thank you. I think that's that finished. Oh, yeah. Chair, do you want me to go through all of the bullet points?
If you're able to sort of summarise and pull out the, the really important bits.
Okay, thank you. So, as I mentioned, this national comms campaign was launched in December 2021. There's the enhanced capacity and capability in the clinical advisory service. Direct bookings now in place. We're developing a dashboard to track the impact. Patients are starting to be booked into same-day emergency care, and their EDs are gradually increasing the number of slots available. So we really do hope that it will have the desired impact, and we're already seeing the benefits of that in ED. Thank you.
Okay, so Rachel Spencer has been called away to important business, COVID related. So we've got an update here from the voluntary sector. Should we leave it there on the table? I don't think we've got anyone to speak to it. And time is moving on. So unless anybody wanted to speak to this, through. Okay, so in terms of these slides, are we going to share them to attendees or anything? Or anyway, it's probably just this bit, isn't it, that no one can speak to. So we may look about, we just get this out to people so they can look at it in their own time.
They're in the agenda pack that's on the web, so it's been updated with these two slides, so those are in there.
Okay, should we move on then? Which is a shame, because obviously the voluntary sector response is absolutely crucial. So thank you everybody for that. Particularly interesting to hear about the progress of the vaccine programme. It's interesting, isn't it, that the vaccine programme is working really, really well, and the benefits of actually getting the NHS to do this rather than large outsourced companies has been stark contrast. So thank you very, very much, and if you could pass on to your colleagues and people in practice across the NHS in terms of the sterling efforts they're doing to roll that out as quickly as possible. Right, does anyone have any questions, any points they want to raise? So we are, I mean, obviously we have two incredibly important items. I've got Mandeep who's raised her hand. Mandeep.
Sorry, thank you, Chair. Mandeep from Health Watch Reading again. Yeah, lots of information there, so thank you very much, everybody. Just a couple of quick comments. David, you asked for questions and queries re vaccine. We're getting loads, so I'll send some over that might be helpful to the work you're trying to do to engage communities. And also to support some of what Andy has said, we've had lots of positive feedback as well from people who've gone in and had their vaccination about how good the process was. They felt supported throughout, and they found it easy even for those vulnerable people. So there's really, really good stories about people's experiences of having the vaccine across nearly all the sites in Reading. My two questions really, is are we going to be getting data on the vaccine take-up by age and ethnicity? Is that something we might be party to try and understand how our communities are developing in terms of having the vaccine? And then the second one is, how is the supply situation in Reading? We hear so much in the national news about supplies and diverted supplies. It's good to know we'll be on target for care homes, but are we likely to see this continual momentum we've now built up and the good work we've done? Do we have an idea about the supply situation? Thank you.
Thank you, Mandy. Two really good questions there. Who's able to answer them?
Chair, I could maybe comment on the data question, if that's helpful.
Thank you, David.
So I think the short answer, Mandeep, is at the moment we don't have that. I think that this week, I think every day this week, I've seen newer and more kind of emerging, but not yet robust and kind of comprehensive data on the kind of numbers of people coming through vaccinations. So whether that's like we just heard from Andy in terms of, you know, from the frontline surgery saying how many they've done, or whether that's that's kind of come out centrally from kind of NHS England, but at the kind of what we call the BOB, you know, the BOB footprint, so the Berkshire, West Oxfordshire and Buckinghamshire footprint. So I think we're getting bits and pieces at the moment, but not quite the whole picture. And I would share your desire to absolutely understand what's happening at that detailed level within different population groups locally. And I know Meriden, our Director of Public Health, has been pushing kind of regionally and beyond to ensure that comes through. So I think it's a bit of watch this space, if I'm honest, at this point. And I think we will get it because we get that for other vaccination programs, but it's obviously not fully with us yet. And on your first comment, yes, please do send through those comments that you've received from and questions and concerns that you've received from community groups. That'd be really helpful to see. I'm not best placed to talk on the local vaccine supply question, though, and I don't know if NHS colleagues are cited on that, Chair.
Thank anybody. Thank you, Andy.
Yeah, I think at the moment we've been supplied based on a gradual wave process. The sites have come on stream gradually. So like I say, my site has been one of the later sites. And then when we got the vaccine, we've got loads of it to give in 10 days, like we've been vaccinating every day. I think at the moment they're looking at the data as we input for each patient who's had it. They're seeing where have we got to. And I think at the moment, because in Berkshire West, we're getting quite well into our cohorts, but there's been a slight lull in supply next week from what I'm hearing. I think they're redirecting it to other areas to get those higher cohorts covered. So next week might be a bit of a lull in terms of activity. But then as we vaccinate more and other places catch up with the highest risk cohorts, we then will get more vaccine to keep going down the age groups and get through more patients. As we come down the age groups, obviously the numbers expand. You know, we've got from the peak of our 100-year-olds, and now we're getting down to the sort of aiming to get down to the 65s, and then the other clinical chronic disease patients is where we want to get to, and then obviously down the age groups. So I think that's the way it's going to be. So there will be a little bit of flux with it. It's not going to be incessant every week. Yeah, we're just waiting for the national team to send us the stuff, and then we get only about a week's notice that we're getting a delivery, and then we got to crack on and ring people and text them and get them booked into the next clinic, and obviously get all the staff up and running to do it. So that's what it's looking like at the moment.
Thank you, Andy. It's really good, interesting to get that sort of frontline perspective. I've got Meriden Peachy indicating.
Hello, I'm Meriden Peachy. I'm the Director of Public Health for Berkshire West, and that's for Reading Borough Council, for Wokingham and for West Berkshire Councils. I just want to pick up David's point and the point you raised, Mandeep, about the information. We are really pressing to get better information so we can understand uptake in the various communities and age groups. But we do tend to know what groups are less likely to take vaccinations anyway, and we do know some minority ethnic groups are less likely to take up flu vaccinations, for example, and some age groups and some parts of the community. So we're not actually waiting. We're taking action anyway. We're already starting to do some work with some of our minority ethnic groups. We're trying to get information out to some of the right places. And another group that we're particularly working with is some of the care home staff, who are not necessarily all coming forward straight away for vaccination. So I think we're taking action anyway, but I'm going to keep pressing that we get better information.
Thank you.
And just one point on the supply. The reason we're not able to order what we want at the moment is partly to do with national supply. It's actually restricted. It's not an unending supply yet. So at the moment, we're getting a share of what's available. So I think we're just going to have to wait a bit on that one, and there isn't an unending supply for this country at the moment. So we're just going to have to work with what we can get. Yeah,
very much. Thank you. And that bit around the take up is going to be really important when there's concerns around particularly certain community groups and Black, Asian, minority ethnic groups less likely to take it up. We have to see what the situation is in Reading, and we've already talked about messaging and stuff we may need to get out to turn that around if it becomes a problem. Right, I've got Ramona Bridgman as indicating.
Hello, thank you everybody. So to remind you, I'm chair of the Reading Families Forum, so we represent disabled people up to 25 and their families, and there's a lot of confusion and we're not sure what to advise in terms of priority 6, so that's 16 to 64-year-olds with health conditions. The National MENCAP are saying that includes people with severe or profound learning difficulties, and we know that they have been disproportionately affected by coronavirus. Should they be contacting their GP and saying, registering as got a learning disability in order to get the vaccine, or what? Because we don't want to trouble GPs when they're already very busy, but what should we be telling our families, please?
Thank you. I've got David. Well, I've got David and Andy. So indicating. So Andy, as you'll come on.
Yeah, from a GP point of view, we've got registers of patients with a learning disability, and normally with children, we've got very good records because we often get letters coming through back from either the paediatricians or community paediatricians or other specialists. So we have them coded as a learning disability. So yes, in due course, as we get down to that cohort that you mentioned, we will be contacting them directly and asking them to come up. I'm about to be doing a learning disability home next week, but they've got patients over 70 in that home. So they're of an age group that fit into that higher cohort. Okay. But the ones that are of a younger age group will be caught up in that, as you mentioned, I think it's cohort 6 under the chronic conditions, and as you mentioned, severe learning disabilities captured under that list. Thank you.
Okay, so families just need to make sure that their young person is on your learning disability register, or their relevant GPs, if they're not already.
If they haven't heard, then yes, but if they've had contact with their GP, then probably they are known to be learning disabilities. Okay. Then they'll come up on the searches that we do.
All right. Yeah. Thank you. I can tell my families that. Thank you very much.
Yeah.
Okay, thank you, and thanks everyone. That's it's been pretty comprehensive, but it's really important, and I think that was really helpful. So we've been going for a couple of hours now, and we've still got a lot on the agenda, so we'll crack straight on. So as I said before, Teresa Bell is only able to be available for a certain period of time, so I'm going to move straight to item number 12, which is the West of Berkshire Safeguarding Adults Partnership Board Annual Report. Teresa, are you? I'm going to hand over to you.
Thank you. That's really kind. Thank you very much, Councillor Hoskin, Chair, and really good to be here today to present the report. This is always quite a strange process, isn't it? Because we're presenting a report for the previous year, and unlike most years, the world has changed vastly since we put this report together in terms of the activities of the partnership. So nonetheless, it's part of our statutory responsibility to present the report to you for 1920. So I'll just take you through some of the points from there, not in any great detail. You've had the papers. So I'm the independent chair of the board, and the board covers Reading, West Berkshire and Wokingham. So it's unusual for safeguarding adults boards to cover 3 areas, but it's a particular arrangement that's been in place for some time now across west of Berkshire, and it works well for us because it means that we are meeting across the 3 council areas with partners that we all have in common, statutory partners, and we also have, as part of the board, very, very good representation, I'm pleased to say, from Healthwatch and the voluntary sector, as well as the statutory sector. So that's us. We have 3 statutory responsibilities as a board that were set out in the Care Act 2014. And those responsibilities are to have an annual report that we present to you and other partnerships as well, to also present a business plan for the coming year. And then our key statutory responsibility as a board is to ensure that we carry out a safeguarding adults review into those cases where we believe that the partners may have worked in other ways in order to mitigate or prevent a particular serious incident or death. So the safeguarding adults reviews are very much part of our core business. So the reports that you have in front of you for item 12, there's 2 reports that you'll see. So the first report in the pack is the one that Reading Borough Council put together to summarise the work that they have done over the year. And then the second report that you've got is the West of Berkshire Safeguarding Adults Partnership Board report. And that's the one that I'm here to present today. So you'll see that the report includes what our priorities were for the year, where we reached on those priorities. It carries data about the cases that we dealt with, and in particular, it talks about the safeguarding adult reviews that we've carried out and the learning from those. And that forms part then of our business plan for the year. So just in terms of Reading, I'm just going to pick out a couple of things for you. So you'll see that there was a decrease in the concerns that were coming in to Reading during that particular year. And we believed that that was due to a recording issue. So there's been work going on this year to address that. There was, we'd intended to carry out an audit to make sure that that was all in place. But of course, the world changed in March 2020 for everyone. So some of the routine work and the routine audits that we would have done, we haven't carried out yet, but we will be going back just to make sure that the recording practice is as it needs to be. One of the other areas that's been an issue for this board, and I think very many other boards across England, is the very low representation of concerns and inquiries from Black and minority ethnic groups. And that's been a recurring issue, and it's one that we're very alive to, and we continue to focus on it with all of our partners in terms of making sure that we are making the right links in communities so that people can make referrals as they should be doing. I'm not going to pick out too many other areas from the report. You have it in front of you. It's a fairly brief report to have a look at. Obviously very happy to take questions, but what I'd like to do, if I may, Chair, is just to say that this particular year, I know that you've had this item on earlier in terms of the response in Reading to the pandemic, and I would like to say, put it on record, how really impressive it has been to be working with the partnership over the last 10 months. People came together so quickly to find ways in order to ensure that obstacles were overcome and that we were all understanding the pressures on the different organisations across the piece, so that we could address any particular problems as they were going along. We met more frequently. Usually we just meet as a board 4 times a year, but the statutory partners I was meeting with very regularly, fortnightly, initially for a while, and then down to sort of 3 weeks, then 4 weeks. We're back meeting more regularly again now. And that was a really helpful way just to keep on top of what was happening, and so that people could make the necessary adjustments to practice and partnership arrangements where they needed to. So it has been quite humbling for me as an independent chair to see just how committed and creative and just really so hardworking the partners have been over this last year. So I just wanted to add that. I know that this is the previous year's report that we're talking about, but it's difficult to ignore what's gone on over the last 10 months. So that's it from me, and I'm very happy to take any questions.
Thank you very much. Right, I've got Tony Jones, Councillor Tony Jones, wanting to speak.
Yes, brilliant, thank you. As lead member for adult social care in Reading, I'm conscious of the time. I'm also conscious that we received this at our ACE committee earlier in the week. And made the same kind of statement, Teresa, as you've just made, that the kind of, we received this with a little kind of time lag. However, it is still of value, but I'll keep my comments fairly brief now in view of the time and the rest of the agenda that's come. However, I did want to acknowledge and thank you for the work that you do and the board that work alongside you, because you are a valued external eye on the work that we do in Reading. And certainly we take the points that you highlight in each of the annual reports seriously, even if sometimes, a single report in itself, I prefer to kind of read them in succession and see if there are trends as well as any particular gaps or any particular issues that need highlighting. So Graham, I'll say no more than that, other than, yes, although this is a report from 1920, we can't ignore the kind of extraordinary pressures and challenges that people working in this field have undertaken in the past year. And thank you again to the independent chair, because your role is important and valued and respected in Reading. Thank you.
Thank you. That's very, very heartening to hear. Really, very much appreciated. Thank you.
Okay, great. Well, thank you, Tony. Thank you, Teresa, very much for that. And thank you very much for coming along. Right, we have got a lot to get through still, so we'll move swiftly on. Thank you. To item number 6, Reading people's experiences of health and social care services during the first COVID-19 lockdown. Mandeep of Healthwatch.
Hello again. Hopefully I won't keep you too long, but this piece of work came out as a response to the changes that services were having to adopt to as a result of the pandemic. And therefore, we wanted to understand people's experiences at this time as services were changing and developing in new ways. We asked it was quite a short survey, and we asked about health and social care experiences over this time, although we had very little feedback about social care services, and it was more focused on health service feedback. The overall summary of this report is that people really accepted and adapted the changes to services and understood that they were necessary. But their biggest concerns were around the lack of communications as the services were changing and developing, and not enough timely communication, and feeling a little left out in terms of their care needs. Some of the key findings of this report were that during this time, 65% of people who responded to the survey used a variety of services. The top were GPs, pharmacies, and attendance at outpatient appointments. Though this meant that 35% of people did not use a service at this time, and we explored that as well. We then gave them the free text option to tell us what went well and what could have been improved about services. And we grouped those comments into what we were hearing more of. Most people made real general comments about general satisfaction of the service and being happy and glad to be seen and taken care of. But there were actually a lot of comments about how prompt the service was, how quickly they were seen and how quickly they went through the process with very little waiting around, as something positive to take from this. And there were also a fair few comments on good experiences of telephone consultations, and considering we're in a new way of working, that's a little reassuring, I think. When asked what could be improved, most people wanted more communication and better information as their main thing that needed improvement of services at this time, which really focused our recommendations in this report. But we did also ask about people's experiences of video consultations at this time, and actually very few respondents had been offered or had the experience of a video consultation. But we also followed that through and took 2 learning points from that. One, that there was an appetite to try a video consultation, and that when it came to video consultations and improving the experience, the best way to do that was to sort out technical difficulties, essentially. And I know Healthwatch England nationally have collated the responses of lots of local Healthwatch around the country on video consultations, and produced a quick little thing about how to improve people's experiences. So it's worth reading. It's just a few points. So just to quickly come back to those 35% of people who did not use the service at this time, we wanted to understand why, to see if there was anything that could be done to increase take-up. And just over half said they'd had no new concerns, so they didn't feel they needed to use a service at this time. But then the other half felt that they didn't want to bother services. They wanted to stay away just in case they caught COVID, or they thought maybe their problem could wait. And we've seen the result of those choices in the increased number of people, coming up to health services with deteriorating health conditions. And I know there has been work done over the last few months, just reassuring, as Nikki did today, reassuring patients to use services when they need them. But it just goes to show how fearful people had become during that time. We wanted to do a final question around gauging people's mental health during this time as well, and mostly people reported they had ups and downs, fair few negative, and some, well, it was a minority that actually felt happy during that whole period of time. And I think when it came to negative experiences and improvements to mental health services at this time, one of the things that came up was around continuity of care for those people who do have mental health conditions. With that falling by the wayside, they felt more and more unwell and left out. Again, it's a communication issue as well. Finally, to end our survey, we gave people the opportunity to leave a message for health and social care staff, a message of thanks or any comments about individuals that we could pass on to them. And really, we received 55 really heartfelt comments, including doctors, nurses, care workers, and even postmen. People were just so grateful for how people were pulling through, and the fact that they were putting the needs of the community ahead of their own. So thank you. That's me.
Great, thank you, Mandy. And so, of course, within the report, I think a really interesting report and really important stuff coming out of there, which also links through to a lot of the stuff we're hearing, doesn't it, in terms of earlier on. There's the responses there from the Integrated Care Partnership, which is obviously linked to NHS and Council and Berkshire Healthcare Trust. I've got Jeanette Searle indicating. Jeanette.
Thank you, Chair. Yes, Jeanette Searle from the Public Health and Wellbeing team at Reading Borough Council. As you say, there are some comments in the report about some support that's been offered out there around mental wellbeing and access to services. I just wanted to offer a brief update on some of that, which is to say that in recognition that there has been this reluctance on the part of some people to contact formal services, we're trying to do more to reach people through community groups. So we've put together a series of courses through the council's Recovery College for Mental Wellbeing to offer training for people particularly working in a befriending type role, to support them with having some conversations and to develop their literacy around mental wellbeing, to be able to identify issues, support people and help them to understand when perhaps they ought to be connecting with other services. We've also been able to draw down some funding from Health Education England to offer training, particularly to people in community groups and front-facing roles where they're dealing with issues around financial distress and difficulty, because we know that can often be a trigger factor. And hot off the press, we've just had confirmation today that we're able to offer some further training of that sort, but this time targeting faith leaders. And the work that's been done through our COVID communications officer has identified the role that faith communities and leaders can play in reaching some of the people that are perhaps facing the particular barriers to accessing these sort of services, and the very real concerns about mental wellbeing in those communities as well.
Great, thanks, Jeanette, for that. As I say, if it feels, I think it was a really good piece of work here, and also you got the responses, and clearly hope that those follow through and lessons learned. I think that's really important. Feels like we should spend more time on this, but unfortunately, the time has been fast. So thank you very much, Mandeep. And if no one else has got anything else to say, we'll move on to the next item, which is item number 8, Special Educational Needs and Disability Strategy. I believe we have Kate Reynolds and Ramona Bridgman. Kate and Ramona.
Thank you, Chair. What we're going to do is I will introduce and run through the report, and then Ramona, who has already introduced herself, who has been very actively involved in co-producing both the report and indeed some of the work that has gone through, will tell you about what it now feels like in terms of Reading Families Forum and the support we're putting in for children with special educational needs and disabilities. So I'm going to summarise a little bit, Chair, given the time is a bit against us, and say, since we brought this report to you last year, and this is our annual report that we bring to you once a year, a huge amount of work has gone on in the SEND space, for want of a better word. I don't like that word space, but there you go, I've used it, so I'll stick with it. Particularly around a number of areas, which I'm just going to outline for you. In terms of finance, the committee will be pleased to know that we increased schools' funding for children with special educational needs back in September 2020, and across the board percentage increase in terms of the money that was going to schools in order to support our children and young people. We are also looking at a new approach to how we fund education and healthcare plans. We are concerned that currently the banding system, which is a system which I think has been around for a significant period of time now, is not quite fit for purpose and is not supporting schools in terms of putting appropriate resources into schools so that they can support children with plans. That work is currently ongoing, and we are hopeful that that will actually roll out from September 21. It is, of course, the decision of Reading Schools Forum in terms of finances and what those options ultimately will be, but that work is going on as we speak. So that's what we're doing in terms of finances. In terms of capital, which is absolutely critical to us, because one of the key planks within our strategy is to make sure that we have provision which is local for our children, so they are not far away from their families and their communities. We have, of course, the new special school, our special free school opening in Wokingham, the Oak Tree School, and that will be opening from September 22. That is for children with ASD and SEMH, and we are working with Maiden Early Trust, who are the sponsors for that school, to make sure that actually that provision is on track and fit for purpose. We are also expanding our our resource bases for social and communication difficulty. One in Southcote School has been open since September 2020. That was previously agreed by members of RBC back in 2018, and we are working to find further provision in the north of the borough. So a big expansion in terms of places and making sure we have capital investment, which again is able to support these children. In terms of alternative provision, we are conducting a review of alternative provision as we speak. That is chaired by Mandy Wilton, who is chair of Cranberry College, who you will know runs services for our particularly vulnerable children and is our PRU. That provision is being looked at to make sure that we have enough of it and that it is fit for purpose. And we will be going through a re-tendering doing exercise, again, to make sure we have a new framework in place from September this year, September 21, to be rolled out across schools. Then in terms of our strategic developments, you will be aware that our strategy runs from 2017 until 2022. So this year, a lot of our work will be focused on developing our new strategy for SEND, taking into account, I hope, Chair, some of the things that we've heard in terms of the approach of the Health and Wellbeing Board and some of the wider strategies across Berkshire. So we're already doing that work, and that work has started with the SEND strategy group, which oversees the implementation of the strategy. Some very, very good news around services to children and young people in terms of our ability to meet our statutory deadlines around the production of education and healthcare plans, which of course are critical to make sure that children get the support for the needs that they have, is that we hit that statutory target, which is to produce those plans within 20 weeks. We hit that twice at 100%, once in September and more recently in December. We are constantly running at over 85% in terms of the production of those plans. If I tell you our figure for January 2020, so when I came to you last year, was running at about 49%, it will tell you the significant change that's been made in that area. We have also put in place a new process for quality assuring our plans to make sure that they are fit for purpose, and a strategy to make sure that the annual reviews for children and young people are conducted promptly and effectively. We have put in new leadership within the SEND team that has built on, and I would like this recorded, built on the expertise and superb leadership of Debs Hunter, who has moved away from supporting SEND just for the moment. But actually that has been fundamental in terms of some of the work that we've done, which has ensured that we're putting in things like new service standards to make sure we respond to parents and families promptly and effectively. So a huge amount of work that's gone on in terms of SEND. We've also, of course, been dealing with COVID at the same time, and Deborah Glassbrook took you through some of the things that we've been doing there. All vulnerable children were given a risk assessment, which enabled us to support them as to whether they should be in school or out of school, and we have used those risk assessments in September to make sure that they come back into school. All our special schools are open at the moment, and we're very, very thankful to our friends such as David Mundy and Meriden for the support they've given us to make sure that school staff in special schools are vaccinated so that they can continue to provide that support for vulnerable children. So that's a quick whistle-stop tour through what's been going on, but it would be really useful for Ramona to say whether it feels any different this year to last year.
Definitely does, despite COVID. And as you were talking and Deborah earlier about all the immense pressures on staff, I mean, I think staff and families are really kind of on their last legs. I'm really impressed that all the strategic work has continued and Kate has provided real clear direction, because a lot of the time we had ideas, we had plans, we had a strategy, but we didn't have all those kind of like the capital programme funding to go with it and all those kind of things. So I think we've got really concrete plans now in place. So that's really positive. Some of the stuff about individual co-production with families are still feeling that it takes a while to kind of get the resources. Perhaps the resources aren't developed yet, but they're in the pipeline. But the new SEN team manager, Nikki Stevens, has been really good. I spent all of yesterday morning with her and the local offer team going through all the information for families and making sure it's accurate, it's up to date, it's really clear. And she's very keen as well to kind of get her case officers meeting with families more and developing those relationships. So I'm hopeful that the individual families will feel that co-production is happening. But I think given all that we've had to cope with and all the pressures, I think the SEN team and Brighter Futures have done a fantastic job in moving the strategy on.
Great, thank you, Ramona and Kate. That is, yeah, it's really pleasing to hear that progress is continuing. What must really be a horrendously difficult year all round. Any questions or any points anyone wants to raise? It's all there. Can't see anyone indicating. Obviously, Councillor Tony Jones sort of congratulate on the progress on the assessments. Absolutely echo that. And Ramona can also say, actually your contribution and input to this meeting in general is actually really useful. So do feel that you're always welcome to come and join us on this board, rather than just when there's there's this item. So thank you very much indeed for that. I thought it was a really interesting read, and obviously really hopeful, positive as well. So Liz, did you want to say anything? Or?
No, but I can't type very well, but there's a no missing in there somewhere.
Okay, all right. It's just basically saying still a lot of work to be done, and absolutely that's and Liz is the noticing the difference, and as I say, I'll echo that, the difference in terms of where we've been over the number of years, and it's really good to see lots of work still to do. So thank you very much, Kate and Ramona, for presenting that. Fantastic. Right. So
thank you, Chair.
Thank you. Thanks very much. Next item is the developing the joint health and wellbeing strategy. So we've got Merridin's going to say a few words, and then we've got Sarah Rayfield. All right, Merridin.
Thank you, Councillor Hoskin. I'd just like to say the health and wellbeing strategy, the integrated care partnership would really like this to be a driving force for the work of the integrated care partnership. They've already considered the 11 early priorities that have gone to consultation. And so it's really an opportunity in this strategy, what we come up with, that it can drive health change right throughout the NHS, all providers and other partners, as well as Reading communities. So I'd just like to commend all the work that's been done. And this is an opportunity, not just for what the Health and Wellbeing Board does, but actually to drive real change through the whole system. And the ICP are keen to do that. I'd just like to hand over to Sarah, who just wants to request, got a specific request.
Yes, thank you, Merridin. So I was just going to go through a brief update of where we've got up to with the strategy so far and share some of the early findings that we've got from the survey. There are some slides. Nikki, are you sharing them or should I share them?
Sorry, can do. Hang on, I will.
I'm happy to.
If you've got them there, then you might as well. Yeah.
Yeah, just I do it.
So I'd forgotten there was slides.
Share the right one. Right, so this basically summarises our journey from start to finish, as it were. So the decision, as we know, was taken back in 2019. We've had quite a long process since March of 2020, starting with evaluating the strategies that were in place, identifying needs of the population, turning that into a long list of priorities, and then reducing that down through a series of online virtual workshops. We're now at the stage of involving the public in further refinement of the potential priorities into the final strategy. And so there's current public engagement ongoing, which I'll come on to. This slide just gives a bit more detail about each of those sections. It's included in the pack, so I'm not going to go through it in detail in the interest of time. But just to say that we are currently, as I say, on public engagement, and this has been co-produced through a task and finish group. The design of it was sort of October, November time. The survey itself was launched in early December and is ongoing, along with other forms. Throughout the stakeholder workshops in the summer, we identified a number of different things that we felt were important to be included in the strategy, although they weren't specific priorities in themselves. And so these are the following themes. So they are that of empowerment and self-care, digital enablement, integration across the system as a whole, but with a focus on prevention, and then also recovery from COVID-19. So the series of workshops over the summer led to a final list of potential priorities, and these are these 11 areas here, which I think we did bring to the board back in November as well. And these are the framework with which we're going out to the public to discuss what their health and wellbeing needs are and what they would wish to see included in this final strategy. Our public engagement is taking this framework. So we've got our online survey. We've been supported by Healthwatch across the 3 local authorities to deliver focus groups on specific target groups, and those are learning disabilities, young people, carers, maternity, older people, and ethnic diverse communities. We've also specifically put a request out to chairs of voluntary organisations and invited them to respond to the consultation through the online survey, and there's been a toolkit provided for where organisations may wish to have further conversations with their members. We've been in touch with each town and parish council across the 3 areas, and particularly focusing on some of these more harder to reach groups. We've been running a series of 3 public meetings. 2 have happened so far, and the final one is next Wednesday morning, to which all are welcome. And we've had residents from each of the 3 boroughs in attendance at those. And we've been to a number of different existing forums and support groups in order to both raise the awareness of the strategy and survey itself, but also to start to have some of these conversations as well. And the plan is that all of this work will will come together and help us to decide on the 3 final areas for the strategy. This is just a list of the different things. So we have a page on the Berkshire West CCG website, which kind of contains all the information, including a BSL translation of the strategy and plans. We have an easy read version of the priorities and what they mean, and we have sort of our roadmap that I showed at the start and all the details of our journey so far, including some of the data that fed into the process initially, and how those priority areas were refined down each of the 3 stages. We've been we've been promoting the survey through social media, through Twitter and Facebook primarily, and are using paid social media posts to promote within certain groups when we've identified that there's been a gap in a particular area. And then we have a specific email address in order to take comments or any other feedback. It's worth saying at this point that, which I will come on to at the end as well, but we have found we've been challenged by COVID throughout the entire process, and particularly more recently and following Christmas with the impact of the new national lockdown. It's made it increasingly difficult for us to do the engagement that we had planned. We've found it challenging in the sense of promoting the survey alongside sort of COVID messages, which obviously need to take priority at this time. But also we've noticed a difference within the capacity of the public to engage with the survey and the focus groups, given that the pressure when we're sort of targeting specific groups, for example, carers, obviously under immense pressure at the moment and haven't necessarily had the sort of capacity or headspace to be able to commit to attending a focus group. So that's been some real challenges for us of late. But just to kind of share some of the early findings of the survey, with the kind of note of caution that these are early findings and are subject to change. And these are the responses as of last Wednesday. So we'd had about 1,300 responses overall, with 459 from Reading, and you can see the breakdown there from the 3 boroughs. In terms of specific responses from Reading, this is a breakdown by age and gender. So mostly, the largest proportion from females, and then the biggest number of people responding was from the 45 to 54 age group. However, it's reassuring that we do have a spread across all ages, including under 18s as well. In terms of the ethnicity of people responding, so the vast majority have been self-described as from white or white British background, and this slide shows both the responses from Reading and Berkshire West overall. One thing of note is that we have found that people aren't answering the demographic questions, and so we're not accurately reflecting all of those people who are responding to the survey in general. So only 175 people declared their ethnic group on this survey response. In terms of organisations that have responded to the survey so far in Reading, that list is here, and we were quite pleased to see there's quite a wide variety of different organisations who have taken the time to respond to the survey. So in terms of one of the questions we ask in the survey is how people would rank the priorities, and this gives us a list that's an amalgamation of those responses different scores as people score them on different levels. So this is how they're coming out at the moment, or certainly were as of last week. So the top priority in terms of this ranking was the one around supporting vulnerable people to live healthy lives, followed by helping children and family in the early years, and then good mental health and wellbeing for children and young people. And then the fourth priority overall was around reducing the differences in health between different groups of people. And you can see the subsequent ones there. Another way that we've asked the question is asking people to identify for each priority what they feel, whether they consider it to be extremely important or not at all important, and then with a number of different options in between. And so this just gives us an indication beyond just that straightforward, what is your top priority? And it's interesting to see that if we consider sort of very and extremely important, then the highest one of this is actually good mental health and wellbeing for all adults. We've included some free text examples from the feedback on the priorities as well, and these are included in the pack, and so quite varied, and people have really taken the time to kind of consider these questions quite well, and there's some really rich feedback included in the survey, which we're grateful for, the members of the public for taking the time, and it's something we're going through already and we'll draw together in the engagement report when we are finished. We also asked people how much change do you think is required, sort of significant change, minimal change, or no change. And this is again kind of, and it has enabled us to ask the question, how much change do you think is required and what might that change be? And we're again getting some really nice feedback from members of the public about what they think would make a real difference to their health and well-being. And again, we see sort of significant change being mental health coming out as top. In terms of other public engagement alongside the survey, we've held a number of focus groups so far, which, as I said, they've been supported by Healthwatch in each of the 3 boroughs. There's a couple left to be held, primarily carers and young people. We've attended the Ageing Well Partnership and Adult Care and Health Services Management Team. The South Reading Patient Voice was attended and sort of mini focus group facilitated at their meeting. And as I mentioned, public meetings now we've had 2. There's one at the time of writing the slides. And then we're also having organisations feedback from different conversations and increasing the engagement on social media. So in terms of our next steps, as I mentioned, we've found the public engagement is challenging. I think we've identified a number of gaps in our engagement, and particularly within the survey, specifically around different ethnic communities that we would like to explore further, and particularly in terms of specific target groups such as carers who are struggling to engage immediately at this time. And in view of that, our recommendation or our desire is really to extend the public engagement until the end of February. The current plan was to close the survey at the end of January, but we feel that having a further 4-week extension will give us the opportunity to further target specific groups and really, do the best that we can do and hear from as many people as we can. This would require an extension to the deadline for writing the strategy. We were hopeful that the first draft would be available in early March, but this would delay this to early April. And then the plans are to have a subsequent consultation on the final draft strategy. I'll stop sharing, but I'm happy to take questions on that process or thoughts on the extension as well.
Sarah, and well, I for one absolutely agree in terms of the extension. We're bearing in mind the groups that we've got a little bit lower involvement in. I think it's such an important strategy. We need to make sure that we do what we can to get that right. Any questions or any points anybody wants to raise? I haven't. Oh. David Monday is saying yes, he agrees with the extension. I've got Maureen McCartney.
Thank you, Chair. I just wanted to say thank you to Sarah for all the work that she's done on this and led on this. It's a hugely important piece of work, and as Meriden said earlier, it is an opportunity to drive real change via this strategy. So thank you.
Thank you. That's very kind.
Thank you. I'm not hearing any more dissent, and Vice Chair Andy Cichescu's also said great work. Sarah, keep going. So yeah, and this is an incredibly important piece of work in terms of keeping the Berkshire West strategy sort of aligned and on track. So absolutely that we get it right. And so thank you very much for the update. No one else is indicating. Thank you very much, Sarah, for coming along and bringing that to us.
Thank you.
Thank
you
you.
for the support from the board as well.
There's no dissent about the extension. So thank you. Okay, so now it's the Student Health and Wellbeing in Reading. This is Mandy again.
Hi again. Sorry, it's got very dark. Bear with me. Thank you for letting us bring this report to here. This is a pre-COVID report and some work we completed between 2018 and 2020. However, I feel this report couldn't be as more important as it is now, because some of the themes within it really speak to our COVID experience of our students. The survey was carried out in two parts. The first focused on first year students, and then we held a roundtable discussion with some of the key partners and requests from our board to go back and talk to students in further years to see if the situation around access and information changes. As a result of actually this whole report, Healthwatch Reading was prompted to produce and design a student card which showed all local services, and it's been handed out in GP services, GP surgeries and the university. So that's been one key outcome as we've done the work. So the survey looked at where students would turn to for information on health and wellbeing, awareness and use of services, as well as their needs when it comes to health and wellbeing issues. The survey findings showed that students were most likely to turn to family or friends when it came to concerns around their health and wellbeing. And as student life continued into years 2 and 3, this remained the same, although there were increases in students now contacting GPs or NHS websites. In terms of awareness of services, most knew about GP services and pharmacies, and that increased over the student life. However, awareness of services in terms of their place of study and sexual health services were low, although at later year students this increased slightly. We then moved to ask them how they access these services and what services they would access. There was a real need to understand and access services around mental health conditions, but this was only at 28% for first year students and only increased to 37%, even though we got lots of feedback around mental health concerns. The only area where it really increased was advice on urgent medical issues, where the awareness of where to find that support became more apparent to students. In terms of actual use of services, this was very much part of the second phase of the report. And students said they mostly use their doctor's surgery. And mental health services had a relatively, again, low use, even though when it came to talking to students about their concerns, there was always so much to say about that. So we concluded the report by asking them what is most important to them in terms of health and wellbeing concerns, and I hope this also feeds into the wider health and wellbeing strategy. And their top 2 concerns, number 1 was stress and worries, and number 2 was weight and diet, and that didn't change throughout student later years. Those remained the top 2 concerns for students. And when they were asked in terms of what do you think can be done to improve? And one of the things they wanted was more information on accessing mental health services and stress-related concerns. We tried to compare this with sort of the national picture, and actually what we found is that there's not much done specifically looking at student health and wellbeing. So this is one of the few reports that is out there. But there were a couple of national reports, and our findings seemed to really mirror what they had found in much larger student populations and much larger surveys. And I just wanted to really conclude that in light of the pandemic, I think it's been evidenced by waiting lists at local services, particularly around mental health services, that the concerns that have come through from students, be they pre-pandemic, are only heightened. And really, I can't see how this cannot be a priority for Reading to address the needs of our students who've been greatly affected by the pandemic, specifically around those two concerns which they consider their top two.
Thank you, Mandy, for that. I've got David Munday indicating. I'll hand over to him, I guess, before I say anything else. David.
Sorry, well, Chair, if you wanted to say something first, please do. I was just going to make a couple of kind of general comments, so I don't mind which order we do.
No, you go ahead, David.
Okay. I mean, I agree with Mandy, but I think that the report is really kind of timely. Although the survey was from kind of pre-COVID, I think having student welfare in kind of sight at this time is important. And I think one of the things that has happened during the pandemic is that certainly from the public health and wellbeing team in the council here, our work with the university has been closer than I think it ever has been, because we've needed to work with them in terms of operating in COVID secure ways, etc. But I think that what that means is there is a strong, there's a strong kind of working relationship to be able to then piggyback on that and build on that to kind of move forward with some of these wider areas of kind of well-being that we kind of need to address, not simply the acute bits of COVID, but the wider impacts of COVID and other issues that the report that the survey highlights. So I think we're kind of, in a funny way, the pandemic's kind of put us on a good footing in terms of kind of making those links and connections and working with them. I think the other couple of things I'd say just quickly is that I think there are a range of services and offers available to students, and I think that can be quite a wide sweep. So it includes things like the meningitis vaccination programme for freshers arriving at university. It includes we've got a community alcohol partnership that has been active at the university campus site. There's a range of areas, and one of the student welfare team at the university is part of our Berkshire-wide suicide prevention groups. There's a range of connections, and I think the kind of mapping of all of that and putting that together and ensuring that offer and those range of services are cohesive for students, I think is important. So, something like a kind of workshop or moving forward to kind of just fully map out and work through what that offer is and ensuring it's cohesive, I think would be a good thing to engage in. And I also would like to ensure we draw in our Wokingham colleagues as well to make sure, again, that offer's cohesive, with the university being kind of coterminous with both Reading and Wokingham council areas. So I think we need to ensure we draw in Wokingham kind of to that conversation and planning as well.
Thank you, David. And I think that's a really helpful contribution, which covers some things I was going to do in terms of addressing the recommendations here. And I certainly agree that I think that, well, a population that we sometimes see, well, I think it was mentioned as transient, they're here and then they're gone, but absolutely, while students are in the town, they're absolutely part of this town, and we need to make sure that the services are there to support them and nurture good health. So we've got the recommendations there, some suggestions from David about taking them forward. I see anyone else indicating more, and I'm presuming that's a legacy hand up on your on there. So thank you, Mandy, for this report. I think it was really it's an excellent and really interesting and timely, even though it was in March, for our relations with and the student population. So we'll take this away. David's got some ideas there, and also to respond to the recommendations. We'll be in touch about how we progress this, but thank you very much, Mandy. Right, okay, so item number 11, the Berkshire West Safeguarding Children's Partnership Annual Report. Deborah Glassbrook, have you made it through to this point, this far? Yes, your DG there, would you hand over to you? Deborah?
Hello, yes, I'm here. I'm so sorry. We're just having a quick internet issue there, so apologies. So yes, thank you very much for the opportunity to bring this report to the Health and Wellbeing Board. You will note that this is last year's report coming to you, and this is a requirement that we provide this on an annual basis. So what has happened here is that back in 2018, was statutory guidance that required us to think about establishing a different approach to our local safeguarding arrangements, and we had to replace what was then referred to as the local safeguarding children boards and find a different, more flexible and equitable safeguarding partnership. So we were very busy back from March 2019 when we established what, under the new arrangements, the new multi-agency safeguarding arrangements, the Berkshire West Safeguarding Children Partnership, and that is ourselves in Reading, West Berkshire and Wokingham. So we have merged into one format really to actually think through what we're going to be doing in terms of safeguarding our children, monitoring and scrutinising what's happening at a local level. And we're very pleased to report that we were very early adopter, and our new multi-agency safeguarding arrangements were published in March 2019 before they were fully implemented in June 2019. And I think huge thanks to Liz Stead from the CCG and other colleagues who have worked so incredibly hard to pull all of this together so that we have now got these new arrangements. So just to give you a bit of sort of understanding of what these arrangements are, this partnership is there to scrutinise and check that we've got effective safeguarding partnerships so that we can actually make sure that we are focusing on scrutiny and the impact of what we're doing, rather than what was when the old, what were called the LSCBs, just receiving reports, looking at the data and listening. What we have been able to establish through the partnership now is a much more impactful and more locally owned arrangement. So the 5 partners in this are the 3 social work and children's services partnerships. So that's the local DCSs from Wokingham, not Bracknell, West Berkshire and Reading. We sit on the executive board, and we then are joined with colleagues from the CCG and from the police. And that's quite different because previously we had an independent chair who came and facilitated those meetings, whereas now it's very much owned by those 5 partners driving what needs to be done at a local level. The other really important thing that's happening is that we're actually then being able to learn together as well. So we're learning from each other across those 3 areas. And of course, we know that a number of our children both go to school in those different areas, but families move around between all of those different areas as well. So the report provides information regarding the first year of being formally operating and the progress of those. And I just want to highlight, if I may, just some of the chief achievements during that period of time. So one of the things we've been able to do is have a clear and effective rapid response process that provides detailed and comprehensive learning for cases at an early stage. So as soon as something happens to a child, we do a serious incident notification to a national board, and then we undertake a rapid review in 15 days to make sure that we can do the learning at a very early stage. And some of the reports that we have put in have been recognised by the National Children's Safeguarding Practice Review Panel as best practice. We've got a new website, and hopefully most of you, or many of you actually, if not most of you, have had a chance to have a look at that. And if not, please may I recommend that you have a look at it. And that brings together all the key information from the previous LSCB websites and makes the location of information so that everybody can use that in a much easier and more accessible way. We have developed what's locally devised and produced a Be Brave Speak Up online campaign, which reached over 81,000 people, with a total number of impressions being 522,445, which and those are being watched about 6.3 times, and they'd been shared a number of times on Facebook too. And this campaign went live to try and help people recognise that they do need to be brave and actually step outside their comfort zones on behalf of children and families who are really struggling, and let us know what's happening so we can be there to support families in times of difficulty. We've got a really strong strategic partnership, which should ensure that the best plans have been in place and that we've been able to respond to risk and protect the vulnerable children and support practitioners and their managers during the COVID-19 pandemic. And that's been a really impactful, very regular meeting that we've had to identify issues as they've come forward. There's been a lot of collaborative working across multi-agencies, and those have captured the views of practitioners that have allowed us to produce the first partnership business plan under those new arrangements so that we can focus our priorities. And we've done a lot of local learning from 5 serious case review, and that learning has been delivered to 167 practitioners as an opportunity for them to participate in multi-agency safeguarding discussions, so that again across the footprint we're able to share the learning and make sure that situations that have occurred previously are less likely to occur again. What you'll see from the report is that each section provides an overview of those key achievements, and under each section, as well as showing you the activities and the impact, there's also learning and challenge in there, which demonstrates what we're going to be focusing on the forthcoming year under those new arrangements. I think it's important to note that bringing 3 different areas together in one partnership has had fantastic benefits, but as you can imagine, it's also come with some significant challenges. We're continuing to work together to overcome some of those challenges and make it the most impactful arrangement that we possibly can. And what you'll see in the annual report on pages 29 and 30 is an evaluation of some of those multi-agency arrangements and what we're going to do to adapt to those in the year ahead, which of course is work that we're currently underdoing, given that this is last year's report. As a partnership, we absolutely wanted to move away from safeguarding assurance based just on the annual reports and working towards embedding this partnership in a learning culture and more mature systems leadership, which will require all our partners to take an active responsibility for the support and challenge of each other, so we can make sure we've got even better outcomes for our children and families here in Reading. So I think finally, just to say, the new partnership model is flexible. It's allowed us to learn and challenge each other. I think it's a really mature relationship. Many of us on that partnership have worked together for a long period of time and are really excited to be working together in this new methodology. We're enjoying sharing best practice across the 3 areas. We're enjoying the learning. We're seeing the skills, knowledge and expertise being developed across all 3 localities. So after the first year, I think it's absolutely right to say that we've got all the building blocks in place for us to make a real impact in helping to safeguard and improve the children's lives in Reading and across Berkshire West. Thank you very much.
Thank you, Deborah, and thank you for that run through of this really important report. I think it was really helpful that you sort of brought a lot of that more up to date to the now rather than the point period that it was that it covers. Don't have anybody indicating that they wish to speak. I'll certainly have a look at the website, like you suggest, Deborah. It's like a nice website to have a look at. So thank you. Nobody's indicated. Thank you very much for the report and for the excellent run through summary.
Thank you, Chair. Thank you very much.
Thank you. In which case we get to our last main item, the Reading's Armed Forces Covenant and Action Plan. Do we have Jill Marston?
Yes, I'm here. Thank you. I'll try and be very quick due to the time, but so this is the usual annual update on the Reading Armed Forces Covenant and the Action Plan. This report also sets out a couple of new developments in terms of Covenant as well. So looking at those first, the first one is new legislation is currently going through Parliament, which imposes a duty on public service providers to pay due regard to the armed forces community in developing policies and making decisions. And I believe that's going to come into effect from about Easter time. So in order to comply with that, the Council's planning to add the armed forces community to the list of groups that is already considered as part of the on the Standing Committee report paragraph on equality impact assessment. So armed forces community will be added to those groups, and we'll also be doing some training with call centre staff so that they can respond in case there is an increase in a number of inquiries from the armed forces community, and they have some understanding of the issues that people might be calling about. And then secondly, there's a new Berkshire-wide Civil Military Partnership Board in development. So that will be, there'll be the Army there, and all of the Armed Forces champions, the Berkshire authorities will be invited. So the idea is that will look at sort of shared action plans and any joint initiatives and joint funding bids. So that's due to get signed off in April and well, hopefully launched in April is the plan, with 2 meetings a year. The local Reading partnership discussed this at their last meeting in November and decided they want to continue anyway. They feel that partnership's useful in terms of local networking and information sharing. So they're the 2 new developments. So finally, in terms of the Covenant Action Plan itself, so say the partnership met in November last time, and the appendix to the report shows progress report against all of the actions in the action plan. In terms of the health related actions, the key one really is the GP surgeries recording veteran status. So I've got a bit of an update on that. Currently got 329 veterans recorded across Reading surgeries. That was as of this December, but I think there's been obviously limited sort of promotion of that this year due to COVID. So I don't think there's a lot of change since last year. So that's the key health related action. So yes, that's it. Thank you.
Thank you, Teal. And well, I can report I went and got a flu vaccine yesterday at my local GP practice, and they were asking everybody a couple of questions, including, did you serve in the armed forces? So,
oh, excellent.
So hopefully other practices are doing that as well. So it seems to be one of the core questions that are being asked to update records. Right, I've got Andy Chichersky indicating. Andy.
Yeah,